Recording in progress.
Ayan. So I'm starting recording the session for this morning. Okay, so I'm waiting. So we're already 41, 42, going up for the class point application. May mga nag-i-in. Yan. Sige. 59. Pataasin pa natin ang number, guys. Yan. Good morning, Nadia Handa. So please change your name so that we can acknowledge yung ating school kung saan kayo nag-aaral or nag-schooling today, no? Tingnan natin ang number of students, yung mga nagpa-participate for this session. So if ever, guys, no, if you since this webinar is free, I'm encouraging you guys to invite your RLE groups section, batchmate, friends, no, to attend the webinar series so that you will be updated, and at the same time you will know the different techniques, no, on answering the different questions, especially if you about to take the NLE, no, or if ever actually some of our materials also, no, we gather it from international references. So it's good that you attend or encourage someone, no, or friends or family members who's actually taking up nursing also. Okay, so we are already 73 in our class point. Yan, you can scan the code in our screen. Sige. Okay, so going up. Sige, just screen take the QR code, no, that posted in your screen, so that you can join the class point as synchronous with our presentation for this morning. Okay. So to start our session for this morning, may I ask each and every one of you guys, which or what location are you in right now? So for those 80 participants or for those students who cannot join the class point, please chat in your chat box here. Now use the Zoom chat box to answer the question so that we will know the demographic location, kung saan kayo nakatira, o sino yung mga audience natin for this morning. Okay, see? 1 minute more. Okay, taga Luzon tayo. Si King is taga Luzon. Saan kayang school? Sila King and Nadia and PB. Nancy. Okay, may mga taga Mindanao tayo. Sayas, Tacloban City. Sa chat box. Okay, one more minute. Andy Nadia. Oh, sa Kulo siya. Laguna, okay? Please change your name so that we can acknowledge your school, and at the same time we are have this session to know yung mga different school or locations ninyo, kung sino yung mga audience natin for this session. Okay? 30 seconds. Ayan. 8, 5, 4, 3, 2, 1. So let's see. Okay. Sige. Some of you guys came from NCR, and some of you guys came from Luzon, and we have also a participant came from Visayas, Mindanao. and wala naman tayo outside of the country. Okay? So, hopefully, no, madagdagan pa tayo next session because we have a series of webinar for you guys. We prepared that, and at the same time, we readied ourselves, no, to help you guys to be equipped and be knowledgeable, no, on the different topics, no, that are critical in the examination, especially in your NLE. Okay? Sige. Sige, let's proceed to the next activity. Okay. Sige. Next question. Which nursing school are you? Type in full. Sige, sa ating chat box. So I'm very happy that we have a lot of students now coming from the different part of the country. No? Although we are also teaching, no, some universities in Visayas as well as in Manila, no. I'm very happy and glad to meet you all, guys. Yan. Sige. Sa ang mga nursing school, ang mga ating audience for this morning. Meron tayo, we have here from Bataan, Pine City College, Laguna Northern Western College. Ayan. And Universidad de Zamboanga. Okay. Central Scholar Manila. Notre Dame Apollo College, si Ms. Nadia, and our Ateneo de Zamboanga University. Pine City, Samar State University, University of Notre Dame Philippines College, sa atin sa mga chat box. Davao Doctors College, okay, hello guys. And your Pine City College and City University of Pasay. Sige, if you're not able to join ang ating class point, you can chat. Yan, Olfu, Valenzuela, UMAC, University of Makati. Sige. Davao Doctors College. Okay. So let's see. Ay, namog siya. Sorry. CEU. CEU Manila, Makati, Miss Gian. Yan. Sige. One more minute. So actually guys, we are encouraging you guys to chat your answer or chat your questions, no, sa ating chat box, no, if you have any, so that we can answer that your inquiries right away. At the same time, our session, even though it is a virtual setup, no, we are actually encouraging you to be active so that parang tayo nagiging may interactions tayo. Okay, we have here also pampamantasan ng lungsod ng Maynila. Okay? Sige. So later makikita natin sa ating class point, no, kung sino-sino pa ang mga nadagdag sa ating university na ating kasama ngayong araw. Sige. 20 more seconds. So hopefully you already had your breakfast or you're eating right now, so that by 9 o'clock, no, when our guest speaker will talk or discuss the topic, no, you're fueled with a lot of energy to listen. Okay, let's see. Okay. Sige, tingnan natin, no. Meron tayong again University of Makati, Lorma College, Lyceum, no, of the Philippines, Laguna. Ano yung letter D? Arellano University, Pasig, Manila, Pasay, PLM, no? PLM tayo. And how about the others? Madami. Hindi ko lang mamove yung cursor. Ayan, PLM City University of Pasay. Good morning sa inyong lahat. No? Sa ating mga active participants ngayong umaga. Kahit maaga tayo, no? Talagang early bird, kahit Sunday pa. Okay. Lady of Lourdes Hospital and College of Caybiga. So, saan kaya itong Caybiga? Is it Visayas or Mindanao? And your Mamidi College Incorporated ba to? Incorporation. Okay? And then the Central Philippine University, CPU. Okay. San Pedro College University, Davao. Good morning sa inyo, mga taga Davao. Okay? At ating mga taga Baguio, no? Mga taga Baguio, Ateneo, Olfo Valenzuela, lungsod ng pamatasan ng lungsod ng Maynila, MSU, IIT. Yan, sige, ang dami natin. And Cebu Medical Center College. Okay, maabot tayo talagang from Luzon, Visayas, Mindanao. Okay? So, very good. Ang dami natin. Ang saya. Next. Sige. I need you to answer, guys, no? What year level are you in now? Tingnan natin kung sino yung mga audience natin, mga anong level ng kanilang ano. Wait lang, at mukhang nag-stop ito. Okay. Anong level na sa chat box, guys? Anong mga level na mga audience natin? May level 1, okay, level 4. Mga magte-take na ng board. Yan, na-stop tuloy agad. Hindi ko na ano. Okay, may third year level. Okay. Hindi ko alam kung may battery exam pa tayo sa may mga university. But then, okay, sige. So here in our class point, actually, we have a lot of level, no? But most of you guys, I think you have, you are in level 4, no? Mga magtutok up na ng board, mag-take na ng board exam itong mga to. Sige, very nice. Very good, no? Here in our One Nurse program, no? Actually, we're helping you guys to be equipped, no? Aside from your studies sa ating mga school, we're helping you guys to be prepared in your upcoming board examination. Yan. So, although it is for the 4th year, but then it is beneficial din sa ating mga iba't ibang level. Okay? Sa iba't ibang level natin, such as yung level 1 after 3rd year. Lalo na mga nagtutok up ng ating NCM 116 o yung mga ating mga MS na subjects. Okay? Sige. Yan, ang daming 4th year. So, hopefully, we help you guys, no, in this session or webinar. Lalo na mga testing strategies natin. Okay? So, may I ask everyone, no? Are you taking the NLE na? Some of you guys, so since we already know your level na, so we'll just need to have a survey about kung kayo ay magte-take na ba agad-agad within this year or by next year. O yan, may nagsagot ng yes. So, si Miss Nadia is BSN graduate. Okay, sige. So, hopefully we can help you guys, no? To be equipped, no, especially in testing strategy, no, answering testing skills. Ay, mabilis siya nag-ano. Okay? Ayan. So, yes, this coming November 2022, okay. Amen to that, Eileen, no? You will take the exam and pass it. No, by next year pa si Andres. No pa po daw si Michelle and not yet pa si Samantha. Ito si Karil. De La Peña, not yet. No. Yes, Susan. So hopefully you can pass it. 2023, PNLE, Giovanna. Okay, may iba not yet pa. But still, it's very good though that you're here and at the same time, you're equipping yourself, no, to be ready for the upcoming board exam. So, it's very good then that yung mga lower level natin is nandito to know, no, yung kahit starting pa lang na ini-equip nyo na yung sarili nyo, no, to be ready on how to answer those critical questions. So, remember ang mga natin, no, ang mga board examining natin, I mean yung mga gumagawa ng questions natin is they're very wise, no, and then they really want to make the question critical. So titignan natin, no, yung mga questions na yun. At the same time, we are here to help you guys, no, to answer those critical questions. Okay? Sige. Next activity, question. Sige, Thomas, mukhang advanced to, no? So, if you will be a nurse today, which country would you like to work in? So, you can upload the photo or picture, your dream country to be working with or working in. Baka iba sa inyo, citizenship na yung gusto talaga, ha? Sige. Okay. Sige. So, tignan natin ang mga image na in-upload ng ating mga students. Ay, Wala yatang nag-upload. May nag-upload ba? Upload nyo lang guys. Meron pa? Kung wala, ayan. Oh. Si Annabelle, Canada. You can chat naman kahit yung ano lang, yung word lang, or yung name ng country na gusto nyo sa ating chat box. Tingnan natin yung mga dream niyo. Canada, UK. Okay, Canada. I worked before sa KSA. Okay, may Australia, Florida, US. Okay, Philippines. Aba, very very nationalistic. Very good. Okay, serve our country prior any country, no? Ayan, so tingnan natin. Dito sa ating class point, we have here the USA, no? The Australia and the United Kingdom, no? Yan, gusto nila makita yung bridge, no? Yung London Bridge ng ating UK, no? So actually, it's very good that you have this aim talaga, no? Na very open kayo to work in other countries. But remember guys, no, it's very good din naman to serve the country as well bago kayo lumipad. Pero here, no guys, in One Nurse, no, as what we are already promoting you guys and helping you guys, it is an application that will help you, no, to actually all over the country or over the globe, no, to help you to find the best fit job for you or area for you guys if you upload in-upload natin yung application, no, for you guys to be fit doon sa ating mga requirements ng mga employer na hinahanap. So we are actually connected in different countries, no, that will help you and serve you on the best of our ability. Okay? So welcome again to One Nurse team. Next question. Ayan. Yeah, sige. So as a student nurse, what advice will you give to yourself or everyone? You can put phrase or words for this answer. Chat in your answers sa chat box if you do not have the class point. So we are already 113 sa ating class point. Yan. Sige. May 9 na sa class point sa ating chat box. Nasaan na po kayo? Sige, 40 seconds. Anong advice ang mabibigay niyo sa inyong sarili or sa mga ibang mga kilala na nurse? Luluha pero di susuko. Okay? Strive harder and pray always. Yes? Okay. Si Sarah is zero. Laban. Okay. Sige. Dagdagan pa ang ating oras. So, sige. More quotes or more praise to come. Love serves, serve with love. I did not count this part to only count this part. Okay. Sige. Yan, nababasa po namin, no? Yung inyong mga answer. No, just no nursing, make it part of you, who you are. Okay. Very nice, Soxy. Sige. Pataas na siya. So 116, only 14 answered. So let's see. So let's see the answers of your co-guests here in this session. Labarn. Oh, may RN pa. Ang ganda, no? Labarn with the heart and sparkling diamonds pa to or shiny shimmering. Never give up, according to Junel. And join free webinars you can find. Oh, sabi ni Gab. Okay? Keep fighting. Okay? Kung kaya nila, kaya mo rin. Tama, Hana. Kung kaya nila, kinaya nila, kakayanin mo yan. Okay? Study and enjoy. Take one step at a time para hindi madapa. Ayan, daming labarn. Oh, labarn, RN. Manage your time wisely. Okay, you got this. We have a long journey ahead of us and I know you can do it. Yes, tama yan. No? Even though you're struggling, no, if you have some problem regarding your activity or your schedule, but then if you really want to have your license or to be registered, no? You will do anything, no? Sabi nga nila, kung gusto, may paraan. Pag ayaw, may dahilan. Okay? You will get there no matter what, according to Sun. Keep fighting, sabi ni Sheila. And patient, sabi ni Darlene. And work hard, study hard, always go back to your why. Enjoy reading all the time, sabi ni Giselle. Keep on going, you may fail and it's a part of your success. And don't pressure yourself. It's okay that you don't know anything. Okay? Kasi may mga testing strategies tayo na ituturo. Di ba, Pamela? Okay, sige. Never stop trying to reach your goal. RN 2022. Yan, sabi ni Joanna. And laban lang always. Fight, fight, fight. Future RN, sabi ni Arlene. And keep on persevering, sabi ni Nika. Focus on your goals, sabi ni Taj. Okay? Take time to breathe and focus. Yan, kayanin mo yan, sabi ni Dulay. Okay? So, ang dami, no? Don't cram, sabi ni Gab. Okay? So, laban lang. Actually, ang daming laban lang. Kasi again, no? It's actually a mixed emotion and at the same time, a battle, no? Of your human dimension. Ika nga, di ba? Pwedeng may mental, psychological, physical, draining. But then, if you want something and you want to have result, no, on those sinasabi nating suffering, at the end of the road, no, may pot of gold na sinasabi. Okay? So hopefully, no, those advice or those words, no, of encouragement will put a burning fire, no, sa inyong mga puso to finish the whole course, no, all throughout hanggang makapasa kayo ng inyong board exam. Malamang sa inyo may mga mag-NLP, ano pa yan, NCLEX. Okay? Sige, so much for that. So thank you for your active participation, guys. Now, I would like just to share you about what is one nurse, okay? So one nurse is actually a helping healthcare professional. It's a helping hand, no, for those healthcare professionals to get the best information on their career progression. So, and connecting the healthcare industry with the best fit healthcare professionals. So making hiring fast, simple, and efficient. And we are actually doing here is we want to become a platform to more than 45 million of health care professionals and can access those information and learn about the practices and improve their careers and share information with those who need and help one another. So our team are experts and researchers, are subjective matter experts with extensive industry knowledge that can provide our HCP with the most up-to-date information and resources. So that's why, guys, I'm encouraging you really to upload, no, the application so you get be updated or you have your sinasabi nilang mag-ano kayo, subscribe, no? Wala namang bayad yan, no? Free yan. Free na binibigay po ng ating One Nurse yan. So for the detailed information regarding One Nurse, may I call our One Nurse team, Miss Maria or Miss Noemi to help me out, no, regarding the demonstration of the mobile application. Ma'am? Nandiyan ba si ma'am? Para mas mag-guide tayo on how to upload and how to navigate the said application on your mobile or device. Ayan, sige. Sige, nasa na po, ma'am?
Hi, good morning.
Ipo-host ko si ma'am.
For a while. I'll share my screen.
Ayan, nakikita niyo ba si ma'am? Ayan. Sige, ma'am.
Okay. Hi, everyone. This is Maria from One Nurse. I'll be doing the screen sharing for the mobile application. Sometimes you can do the explanation.
All right, I'm so sorry. I'm having trouble with my with the sharing. So hi, hello everyone. Good morning. Thank you for joining again to our third webinar series, NLE webinar series. So we are very glad to have you this day. So I'll be sharing to you how we can use the application in our platform. So this is very helpful for you, even though you are still a student, just to especially we will have new features on our platform. So this will be the first thing you will see if you will open the app. So alright. So this is our mobile app. The good thing is here is very convenient on your part. So the first will go to home.
Yes, right. That's right, Noemi. So these are all the articles. So if you open the mobile application, you will go directly to the home where you can see the latest jobs posted on our platform and also the blogs. So these are the newly published articles on the platform. Okay. And next, Noims.
Yes. For example, for if you want to like in the blogs, if you want to like go to the countries.
Okay. So these are all the countries. So once you click the countries, you can see how is nursing in other countries. So for all of you guys who have commented earlier which country you would like to practice your nursing profession, here you can see all of it. So for example, for those who want to go to Canada, let's click Canada. So here you can see all the articles related to nursing in Canada. You can also see here how to become a nurse in Canada. This is a guide for foreign nurses, for us, for all of you. So here you can see an overview of nursing in Canada, the pathway. Oops. Okay. So yes, the salary, the working environment, all that you need to do. I mean, all that you have to know if you want to work in Canada as a nurse. Okay. And next, Noims.
Yeah. Next for the third is the job, where you can see all the jobs available on our platform.
Yes, that's right. Yeah.
So for
yeah.
example, you are looking for a job in Makati.
Okay, let's go to Makati.
Let's
So if
search.
you look for jobs, you can actually specify which which region or which specific area you would want to look for jobs. So let's say for Makati,
Yes.
you can just search jobs. Okay, so here there's one. Oops, but it's posted before for the Makati area. This is the job for Makati area. But if we do not specify any country, let's say we would want to look for jobs. Okay. So search for jobs. No, this is not the one. Okay. Let's say anywhere in the Philippines. So this one. You can also search if the relevance latest first. So let's go for latest first. All of the jobs that is posted are recently will be shown here. So you can see here jobs from different hospitals, and you can also see jobs if you want to, let's say, take a rest for a clinical setting. You can click a BPO jobs. You can see example of a BPO healthcare industry company is EXL. So currently they are
Yes.
looking for USRN who can work with them. Okay, so you have many options what to apply. it's either clinical or BPO healthcare industry. So you can click apply. You can click this heart here. Okay, say I will click. So this will go to my save jobs. Okay, let's see here. Yes, you can see here the jobs saved. There are 4 jobs applied. So here's the history of the jobs I have applied before. Just an example. Okay, and there's saved jobs. I have clicked 2 hearts. There are a lot of jobs you can see in the platform, right? So before you would go to apply, or maybe you're just thinking which one you would apply, you can click heart. You can click the heart so that it will be saved in your my save jobs, and later you can look for you can see here your save jobs, and then you can apply. So you can just click apply. And next, for the profile, this is your profile, right, Noims?
Yeah, where you can edit your school, your work history, and if you are a student, you can just uh, do not put some inputs of that since you are student. But yeah, it will be still um it will be still per, you can still edit it in
Put,
your
yes, all
future.
your details. So for
Yeah,
example, your nationality, of course, we're from the Philippines, and current residency, we're from Davao at the moment. And the education, you can also put here the education, the work experience. This is just an example. So work experience, you can put all your experience here, the licenses, certifications, skill sets, and languages. This app is actually designed especially for the healthcare professionals. So all the certifications you can see here, or all the options, are related only to the healthcare industry.
that's right.
Also the skill sets and the licenses. So all the details that you have put here in your profile, so we can go manage your CV. So here's the CV, the Wonders template. So all the details that you've put here, we will manage it, and our CV builder, the Wonder CV builder, will do its magic. So let's say we will download. Okay. Okay, let's view the CV that was made by our CV builder. So this is how it will look like. So we are encouraging everyone to put all your details, because employers will see what the details you have put. And if they will download your CV, here's what they will see. So again, encouraging everyone to put all your details here. And by the way, you can also upload your CV if you have already your CV. But the good thing about the CV builder of Wonders is it is designed especially for employers to see all your experience in a way that it's good for the eyes, and it's also easy for them to process your application if you use our CV builder. So yes, I think that's all.
Yeah,
So for those of you who have yet to download the Wonders app, we are encouraging you to download the Wonders app and put NLE in the promo code so that we will know that you are one of our participants.
yes, that's right. So yeah, I hope you can download and register now to our platform. It's really good because we are more focused on the healthcare industry. So yeah, we are also inviting you guys, if you are for those who are planning to go to abroad and wants to take IELTS, we will having also a free IELTS guide webinar this coming October 3,
That's
2020.
tomorrow.
Yeah, it's tomorrow, Monday, at 7 p.m. to 8:30 p.m. Our resource speaker will be Mr. Irvin Neil Temporal. So hope to see you guys. And for those who are not like, if you're not going to take the IELTS, but you have somebody know about who wants to take, so kindly share. So we are encouraging you to join. So I hope you see you guys also tomorrow.
Thank you so much.
Yes, and to all those who will participate, the Niner IELTS Review Center, it's one of the top review center here in the Philippines for IELTS. So if they will attend, they will be giving free tutorial. I mean, yeah, and free one-on-one for those who will attend. So for those who are planning to go to abroad, you can join this webinar, the free webinar tomorrow. I will be sending the link to the comment section so you can share it also to your friends. And that's all for Wonders. Thank you so much, everyone.
Thank you, guys.
Yan. Thank you. Thank you, Ma'am Maria and Ma'am, hindi ko makita si Ma'am isang
Thank you, Ma'am Rona.
Ayan, thank you for that announcement and giving the opportunity and giving those information as an opportunity for nurses na maano po natin, no, to explore more detailed yung ating One Nurse application. So now I'll be sharing your schedule, no? I'll be sharing the schedule for our the following webinar that we will have, no? So now today is October 2, so our topic for this session is cardiovascular nursing. And the succeeding week will be endocrinology and diabetes nursing. And your October 23 will be emergency and critical care. And October 30 will be maternal and child health nursing. And for the month of November, November 6 is our final coaching for your board as a preparation for your board examination. Okay? So a disclaimer lang po to all that the contents and the slides are for fair use, no, for education and academic purpose only. So no copyright infringement intended on all references, text, photos, materials, and video clips, links, resources used. So the authors and the owners reserve all the rights. Okay? Heads up lang to all. Okay? So as an introduction for our speaker for this morning, so he is actually called, no, marami sa ating mga student na hawak niya, ang tawag sa kanya is Sir Royce, Professor Royce, no? And Sir Royce, a little bit background, no, about his educational attainment, okay? He actually acquired his BSN from Manila Doctors College and MSN from University of St. Paul University, Philippines, and a doctoral student at St. Paul University, Philippines. So actually, he began his career at Philippine General Hospital and Manila Doctors as a medical surgical and oncology nurse. Okay? His extensive clinical background spans multiple healthcare settings in the area of telehealth, medical, surgical, and oncology. Okay? So lahat na, no? Cover na ni Sir Royce. At present, actually, he is currently a clinical case manager at ACE Medical Healthcare and Hospice in the USA, which is a remote form of platform of work, no, for us nurses. So ang daming venture. So makikita niyo yan or ma-share ni Sir Royce yan. Okay? And actually, he adjunct to that work, no, he is a professor to different universities such as St. Paul University, Philippines Graduate School, and he is also a certified medical coder, certified learning development professional, Six Sigma Green Belt in Healthcare, and a proud volunteer, no? Volunteer po ng ating Red Cross Philippines and an active member ng ating Sigma Theta International Pil Gamma. So he is actually passionate, no? Very passionate in caring to those individual, especially students, no? Kaya po talagang full-fledged si Sir Royce yan. Students to become instrumental in various extracurricular affairs, no, that will advocate as nurses in rights and healthcare welfare. So again, Sir Royce is currently pala din, to heads up lang sa ating lahat, no, he is currently launching his own blog, no, called nurseroyce.com, which is a site that encourages hope and devotes well-being by inspiring nurses, no, or nursing student, no, to have an extensive list of nursing content, no, lahat ng mga encouragement and materials you can see sa kanyang actually page, no. And he is also an administrator on a Facebook group called Registered Nurse in the Philippines with almost 200,000 members. So please guys, like and subscribe, no, that Facebook page of Sir Royce. Let's support him. No, because I think he give too much for us, no, and to you student. to be equipped in your near future career. Okay? So without further delay, I would like to give the floor to Sir Royce Narvaez as our lecturer for this morning about cardiovascular nursing. Okay, take it over, Sir Royce.
Hi, good morning. Can you see my screen? Kita? Meron ba?
So please, raise hand. Ayan, yap daw.
Alright.
Yes daw. Yan, sabi nila
All
gap.
right. Yeah. So I'll be discussing the care of clients with cardiovascular disorders. And thank you so much, Miss Topacio, for that kind introduction. All right. Syempre, kamusta namin muna kayo, right? Syempre kanina, everything is, on the spotlight. One Nurse is providing this kind of, platform to be, magbibigay ng information to you, and also, it will also guide you as you go along. Especially, even yung mga hindi pa graduating students, di ba? Makakatulong to as well, especially when you're taking your exam, and also, as a tip as well for you. Okay, so how are you guys? So please raise your heart if you are doing okay. So let's start. Sige, heart muna tayo kung nandito na kayo, and let's start with our discussion. 27 naka-heart. We are 242, so I'm expecting 242 yung mga naka-heart. 40. Sige mo. Medyo nawawala yung mga heart actually, but I know the rise of our heart is, fluctuating. Anyway, I hope I will be able to give importance on how we take care of our clients with cardiovascular disorders. And as for disclosure, of course, I'm not representing any school. However, I'm practicing in telemedicine, telehealth, and also a consultant of OneNurse.com. So that's what I want to disclose with, okay? And as mentioned by Ms. Rona, of course, this presentation will be used for education and academic purposes. And all of those information reserves all the right for the sole authors and owners of that information, okay? And some of these, of course, are also based on my experience. As for objectives of this presentation or of this webinar or this discussion, so I'll be discussing nursing implication to our patients with cardiovascular related disorders, such as the hypertension, MI, CHF, angina, and cardiogenic shock. So I know that some of you may be able to have that discussion already with your past professors or lecturers, and even your RLE, right? So we will just do a quick lesson, and then review, and then of course we'll apply that as your test taking strategies as a tips for your board exam, and even yung mga exam nyo and quizzes, right? All right. So just an overview of, we have a lots of patients in the, having cardiovascular related disorders. I won't be starting about unofficial because it's already a basic, and, if you will be working in the medical surgical unit, sa mga wards, or kahit saan man yan, majority of those patients do have cardiac related disorders or cardiovascular diseases. So some of those may have chronic conditions, some of those may diabetes, cancer, pero meron din silang heart-related concerns. And, as for World Health Organization, this is the latest statistics and overview. So, it is the leading cause of deaths worldwide. So, it's the top one, actually. So, when you see that statistics, number one is, patients with cardiac related disorder, and an estimate of 17.9 million died from CVDs that is in 2019. So that is the latest statistics in World Health. So it represents 23%. So imagine there's a lot of patients with having cardiac related disorders, and that represents a global death. And of this 85%, syempre, they were due to heart attack and then even stroke. And then yan, we have premature deaths, which consists of 17 million. That is under the age of 70. And that is also due to non-communicable diseases. And 38% again caused by CVDs. Syempre, most cardiovascular diseases can be prevented by, addressing mga behavioral risk factors, right? We're talking about risk factors like smoking, tobacco use, mga diet, even unhealthy lifestyle, right? And physical inactivity, and even alcohol. It's really important, we focus on patient education, especially when you become nurses, kailangan yan. And, really important, it's vital to detect cardiovascular diseases as early as possible para, we could provide better counseling, and then kailangan mag-start na ng medications, and, ayun, wala pala ako sa picture. Ayan. And, medications could begin para at least to prevent further complications. Really important yan on the aspect of care with our patients. So we need to discuss those, behaviors that we inculcate to our patients. Yan, as for my practice, I'm doing telehealth for the past 4 years. Although I have, mentioned ni Ma'am Topacio, di ba? I'm in the medical surgical ward. But I also focus on oncology. But a lot of my patients do have cardiac-related disorders, hypertension, and blah, 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 blah. So right now, I'm doing remote patient monitoring, so telehealth, telenursing. So ito yung binibigay namin kay patient, papadala namin ng blood pressure. Yan yung device, ito yung cuff. Ito yung, we call that gateway. So that gateway is yung parang router yan. So pag BPC patient, syempre, we educate our patients kung how they do their blood pressure. Ine-assess muna namin kung marunong ba sila. Kung hindi, papupuntay namin sila sa clinic. So sa clinic, papadala namin sila ng blood pressure or sa bahay nila. So once they are at risk for, even, hypertension or existing hypertension na sila, yan, we will educate further for remote patient monitoring. Ayan, nag-BP na si patient. Ayan, araw-araw sasabihin ko, not just araw-araw, pwedeng as regular as possible, right? Kasi maganda, mag-check sila ng blood pressure. It's really important para maiwasan yung mga, complications, and also, baka hindi effective yung medication management. So right now, this patient, we'll call this patient Pamela. Yan, si patient Pamela. Tumawag ako kasi last time is September 6. Ayan, there's really, pag nag-BPC patient, ayan, papasok yung diretso yung hindi ko yun ine-encode, automatic yan. Pag nag-BPC patient, naka-open si gateway or tong router, papasok yung blood pressure niya. Mag-a-alert yan sa akin, magte-text yan actually sa akin or sa email. So lahat ng platform ay mataas. That's the time we call the patients as well. So we further assess. Syempre, yan yung important natin as nurses, right? Assessment first. We verify, validate natin, mataas. So pina-recheck ko yan ang pina-recheck, and then, although hindi pumasok kasi yung baka hindi niya napindot yung router, but we actually recheck that blood pressure. Tapos yan, kinordinate ko siya sa nurse practitioner. Kasi yung mga nurse practitioner sa US is, pwedeng ibahin yung medication, taasan yung dosage, yan. Si patient, dalawa ang medication, amlodipine, saka metoprolol. So ayan, in-increase yung amlodipine actually niya. So naging, stabilized, pero mataas pa rin actually on the other hand. Yung previous yan mataas, hindi ko lang napakita, but really important yan. Tapos pinapunta na namin siya sa clinic kasi kaya pa naman, hindi pa naman siya on the side na, urgency or emergency. Kasi wala naman siya mga other signs and symptoms like headache, dizziness, or chest pain, right? So medication management actually is really important. And nalaman ko pala is nag-stop din pala siya ng medication. So nagkakaroon ng rebound, 'di ba? Effect. Kaya kailangan akala niya kahit normal yung blood pressure niya, i-stop niya or as needed na lang. Hindi, 'di ba? Dapat it's a chronic, maintenance on the side of the patient. So that's really, actual experience right now. So I'm dealing a lot of patients, and when we call that patients, and then sometimes we do Zoom as needed, pero usually kasi matatanda yung mga patient namin, so over the phone is also important. So mas convenient. At yan, we also call the pharmacy, the laboratory, the imaging para makita yung mga result, and then isa-send some electronic records. Okay? This is one of our electronic records actually. And then pwede kami mag-communicate via chat box, and then email din yung mga patient, on the platform itself. Okay? All right. So we're talking about hypertension, right? So first, syempre, I know that this is really basic on your end, right? So let's really talk about quickly about blood pressure is. Syempre, these are diagnosed after readings that will fall into separate locations. Usually, at least consecutive, 2 to 3 times consecutive clinic readings. Kailangan ma-check siya bago siya mag-diagnose ng hypertension. Syempre, hindi mo sasabihin, ay, may hypertension po kayo agad-agad. You have, mataas po yung pressure nyo, or you have an elevated blood pressure. And then, lalo na pag first time or at least patient, right? So kailangan mag-check pa rin siya afterwards. And then pag mataas pa rin, lalo na we encourage patient kaya bumili sila ng blood pressure or pumunta sa health center, right? So really important that syempre we are not to diagnose but our providers. And once they are diagnosed, syempre knowing that yung risk of the patient, right? Dapat na siya mag-comply ng medications and management as well. Siyempre, we already know, these are classified in our blood pressure. Siyempre, systolic, diastolic. Systolic pressure, siyempre, it is the one where it is exerted on the blood vessels, right? So when the heart contracts. And then for the diastolic, siyempre, it is the pressure within the vessels. So it is between the beats, right? Or when the heart is relaxing and then contracting. Yeah, so that's one of the parameters, right? So when we report, syempre, blood pressure, normally, of course, it's 120/80 systolic, 120, 80 diastolic. And then the third metric I want you to know is, we're talking about mean arterial pressure, or the MAP we are calling. So you'll see this a lot when we will talk about, mga vasopressors, medication, or patient with, even neuro-related disorders. So it's a calculation of the average pressure within the arterial system. So it looks like yung full cardiac cycle and takes average pressure. So we sometimes also hear mga pulse pressure. It's a difference between the systolic versus diastolic. So it really gives an idea of how hard the heart is really working. So we use that a lot with our cardiac patient and even other patients. Ayan, when it comes to symptoms, syempre the reality, of course, with hypertension is that there are no symptoms until it starts, causing end organ damage, right? And that's why we call it is a silent killer. Silent killer. So someone may not check their blood pressure regularly. Tapos wala siyang idea, right? Na may hypertension sila. Tapos marami pa silang mga, concerns on their health and other issues. So it is non-specific. So we do have primary and secondary hypertension. So yan. Papasok yung, syempre, dapat alam natin yung mga risk factors, like yan, say patient with, there's a high capability that if the patient do have, heart-related family history, so syempre, probably, it may causes as well, di ba? Race, yan, sa African Americans, so there are studies na matataas yung hypertension. Although, as you can see, right, globally naman, even, hindi naman sa race yan rin. So, even with us, right, still number 1 here in the Philippines. Increasing age, of course, that's the other thing. And we talk about modifiable risk factors, yung mga patient na obese, mataas yung BMI, mataas yung cholesterol, may other yan, cardiac-related disorder like CAD, tapos lagi sila stress, pa sila, smoke or even tobacco smoking, mataas yung diet nila sa salt or fast foods, even coffee, right? And then later on, they would have, secondary causes or, there's an effect of later signs like yan, may mga visual changes, even yan, kasi nga, di ba, there's an effect on the pressure and then on the vessels of the eye. So nagkakaroon ng vision changes as well. And then chest pain, yan, dahil nga chest pain, there is a strain on the heart. So yan, the biggest thing here is, syempre, if they are not really compliant or not being able to do their health, actually, dapat annual maintenance checks or for the patient with hypertension, usually every 6 months or as needed na, as long as it's maintained or na sila stable. So really, it really, encourage that patient na kailangan magpa-check na sila. So the biggest thing here, di ba, yung end organ damage. So mataas yung high blood pressure, syempre, na sila, risk for stroke, risk for, renal failure, heart failure, lahat, heart attack, myocardial infarction. So patient may also have, initial symptoms like headache or yan, I mentioned earlier, blurry vision. Mataas, sobrang taas, 240 pala, over 100. So really alarming, right? And may stroke na, di ba? Nagkaka-stroke. And then really gradual pa yan, baka mababa para hindi pa siya aware. So we need to stress the importance na kailangan talaga pa-check ng lagi magpa-check sa provider. Kahit ng health center, okay na yan, right? At least, alam nila. And then, yan, really important. Tapos meron tayong mga secondary hypertension that causes yan ng pregnant women like preeclampsia, eclampsia, renal disorders yan dahil nga dahil mataas yung BP, so there is a increase or decreased perfusion sa kidneys natin as well. And then since the patient is having yung heart is working overtime, so yan, nagkaka-stroke, and dahil nga may vascular damage, yan, prone din sa, or patient with diabetes, prone rin for hypertension due to vascular damage. So the patient with this condition are really, yan, at risk yan. And we see here that there are a lot of blood pressure categories. This is from American Heart Association. Meron din sa mga joint committees of, European Council and everywhere. Iba-iba kasi yung mga But syempre, AHA is one of the leading organization in terms of, yan, prevention on the heart aspect, right? May sila, American Heart Association, ACLS, and then leading cause of, patient of having problems with heart. Syempre, kailangan natin malaman is, is that patient on the stage 1, stage 2, or in the hypertensive crisis. We all know it's 120/80. Medyo elevated na, 129 to or less than 80, right? And then goes on, tumataas, 130 to 39, and then 80 to 89. That is on the stage 1. Stage 2 naman, 140/90. And then, meron pa yan mataas. May stage 3 pa nga sa ibang guidelines. And then, we're talking about hypertensive crisis, right? So, sobrang taas, 180/120. So, we need to advise our providers immediately. At actually, dapat sa health center din or lalo na pag may mga symptoms, headache, dizziness, or anything, right? Kailangan talagang magpa-check up. So that is one of the blood pressure categories, but based in American Heart Association. So as we go along, syempre, we are not the one who's giving the medications. Syempre, yung mga providers, they are the ones, sila yung nag-immediate, diagnose with that patient. So yan. Syempre, pag mataas, bibigyan na ng medication or pwedeng lifestyle muna. Mga pharmacologic therapy, mga lifestyle habits, mag-smoke, babaan ng asin sa katawan at mga fast foods, right? Kasi hindi naman natin mapapalitan yung mga modifiable risk factors, right? So ayan. So pag mataas na, mga stage 1, stage 2, probably may mga medications, combination syempre maganda, 'di ba? Pharmacologic therapy saka BP, lowering medications. So dependent on the clinical estimation or the cardiovascular disease risk. So yan kung paano sila nagbibigay ng medications. But we won't be digging further that, okay? Because we are not it's about dependent, 'di ba? Nursing intervention. So when it comes to symptoms, syempre diarrheality, syempre yan nga sinabi ko, 'di ba? It's a silent killer. Some may not able to check their blood pressure regularly. Ayan, at wala silang idea. So papasok yung mga later signs na tinatawag. Although I mentioned this a while ago already, right? Yan, nagkakaroon ng mga visual changes, blurred vision. Yan, frequent changes. Dizziness, nahihilo, at nagfi-faint pa nga, di ba? At yan, sumasakit din ang dibdib, nagkakaroon ang angina. And later on, yan, we already talked this a while ago, right? And organ damage later on. Pag hindi talaga na-maintain at hindi talaga nag-comply si patients. Okay? As for management, syempre, when it comes to medications, syempre, the goal for hypertension, syempre, is to address the blood pressure. Syempre, most hypertensive patients will be at least, one medication, pwede ring combination of drugs. So, dependent kasi yan, di ba? On the doctor's order. So, because they all have, different mechanism. So, as for ACE inhibitors, ano papasok dyan? Ano yung mga ACE inhibitors? Pakitype. ACE inhibitors. ACE inhibitors. Ano yung mga ACE inhibitors? Nagre-review lang tayo. Pakitype. Ano mga ACE inhibitors? Captopril. Ano pa? Captopril, alam nyo. Ayan, marami actually. Perindopril, captopril, lisinopril, ayan, pril yan, okay, pril. Ayan. ARBs, ano ba yung ARBs natin? ARB, sartan. Sartan, okay. Sige, alam mo na. Losartan, valsartan, irbesartan. Okay. Beta blockers, ito, medyo pinaka-basic to. Alam nyo dapat to, beta blockers. Pakichat. Ayan. Olol, propanolol, metoprolol, kung ano-anong kolol. Siyempre, yan, really important yan. CCBs naman, atenolol, okay. Acebutolol, yun, maganda yan. Calcium CCBs naman tayo. CCBs. Ayan, dipin. Ano pa? Nifedipine. Correct. Ayan. Correct. Din tayo dyan. Okay. And lastly, diuretics. Ano yung mga diuretics? Mga AIDs. Ayan. Loop diuretics. Ayan. Mga furosemide, potassium sparing, hydrochlorothiazide. So, syempre, these medications are really important, to prevent water retention. Itong ACE saka ARBs. So, this will prevent, water retention. Tapos, pwede ring, it's really important, di ba? That causes vasodilation. So, beta blockers, Syempre, that is, important to slow down the heart rate at also decrease cardiac contractility. Hindi ko lang nababasa yung sulat ko, but it will decrease cardiac contractility so that, yung pressure magdi-decrease yan. And then CCBs, syempre, relax. It will relax. Relax the smooth muscle in the vessel. So, yan, syempre, it will dilate at later on decrease din ang cardiac contractility. Okay? Sa diuretic, syempre, it's a, to offload the system, right? So overall, syempre, pag remove some of that preload, so syempre, the overall BP could also decrease yan, mga furosemide, hydrochloroside, ayan, aldactone, ayan, Lasix is a brand name, right? So we give them and dapat comply sila ng medication management. Maganda, dependent yan. Minsan pinapainom sa umaga, pinapainom sa gabi, or in between, right? So there's so much the patient could improve to their hypertension, and education is a must. Compliance of medication is really a must. Okay? Ayan. Tapos na. Ayan. Really important. Ba't ganun na ba na isang slide? Ayan. Siguro hindi ko nalagay yung isang slide ko. Siyempre, yung patient education. Kailangan mag-check ng lifestyle nila, ng habits nila, mag-check sila ng blood pressure regularly or as needed sana. At kapag may nararamdaman na sila like the headache, something urgent, tawag sa emergency or hindi ko lang kung uso yung 911. So pwede, 911 dito sa Philippines, pwede rin naman yun. Kasi it's part of the emergency system natin. Okay? And then, lifestyle, right? Kailangan smoking cessation. Kung hindi ma-stop, bawas-bawasan, okay? At healthy diet, mga later on siguro dun sa kabilang slide. Sige, try natin to. All right, so we have this question. A client is, may question ba kayo nakikita? Taas kamay, heart. Ayan, undergoing cardiac stress test. Although hindi ko naman na-discuss about cardiac stress test kasi syempre really important to. It's a part of the test that the nurse should be also, anticipate for these patients. Ay, nahirapan huminga, short of breath with a blood pressure drop from 130 bumaba, naging 98. So bilugan natin yung pinaka-latest, 98 over 58. What is the action of appropriate or the most appropriate? So cardiac stress test. So ayan. So administer cardiac glycoside like digoxin, right? Siyempre mababa na yung patient natin blood pressure, di ba? Bababa pa lalo na yan mga may patient baka minsan hino-hold muna yan actually. And then, or kaya, depende kay doctor actually. Pwedeng mag-take muna ng BP meds, but yan digoxin, bababa lalo yan. It is mostly likely contraindicated. Bababa lalo yung BP. Have the client to take a break for 5 minutes before resuming. Ayan. Oo, important yung rest, right? But, i-resume mo pa ulit, right? So the client has a multiple symptoms or pwedeng, dapat stop muna and notify the provider or syempre minsan hindi naman tayo nag-administer ng cardiac stress test. May mga ano natin, technicians on the heart station na tinatawag natin, right? Ayan, marami akong patient kasi lagi ako mga nasa hospital ako lagi taga wheelchair sa mga patient sa ano heart station. Ayan, magano siya sa cardiac stress test. So, kailangan naka-rubber shoes sila para yung comfortable, right? Pwede rin mag-take ng blood pressure, depende. Baka kasi lalang bumaba, but they will be, doing treadmill stress test. Continue to monitor the blood pressure. Ayan, important syempre to recheck. And papa-continue ba, right? The nurse should stop the stress test or kung sino man niya may shortness of breath pa siya. Ito pala, hindi natin nabilugan, shortness of breath. Yeah. So important here is letter D. The stress test and the assessment, rechecking, notification of the provider will be the next steps. Okay? It's really it's an outpatient procedure actually. Mabilis lang, pwede naman inpatient, pero dapat it will determine if the patient could tolerate that exercise. Siyempre, if his heart could tolerate it, right? Ayan. Kapag siyempre, the patient could not tolerate, so baka may worsening, conditions like yan. Si patient may shortness of breath, so kailangan i-stop. And then, recheck, assessment, notify the provider, magpahinga muna at ibalik sa ward. Okay. O kaya, paupuin muna dun sa gilid. Okay? So letter D. Yan. Clear, tas ang kamay. Heart na lang pala. Para kasi heart tayo about cardiac. So put heart mark if we are clear sa letter D. Next. Okay, 5, 4, 3. Yung iba sa chat box pwede. Ayan. Patient, ayan, wait lang. A nurse is caring for a client taking hypertensive medications like enalapril. 10 milligrams for high blood pressure daw. Pero she knows that the physician has changed the dose to 40 milligrams per day. So ano ang better response for this situation? Letter B, administer the dose as ordered. Although nakita mo na naman talaga, in order naman yung order, right? Pero syempre, may discrepancy on the patient's, instructions versus the order, something like that. Or syempre, mga patient rin really stressed for taking medication. Or na sila, hindi na nila alam kung ano yung pinaka-latest. So letter B, muna natin yan. Ipapark muna natin yan. Okay? Ipapark muna natin yan. Because, the dose is really different from the previous order. So, the provider, syempre dapat maganda. Clarify. Provide precautions. Important yan, right? But, wala namang yung situation, wala nang bumababa yung BP, right? Pero, syempre, as part of our education, kailangan i-contact talaga pag may hypotension episodes, right? So, important but wala naman sa situation. So, may mga sumagot. Check the BP. Ayan. Magtitig naman ng blood pressure, right? Although, important, syempre, mag-check ng BP. The dose is 10 milligrams and it's 4 times, di ba, higher or from the previous amount. So, the nurse should contact. So, hanapin natin si Dr. Late, this time. Kasi minsan talaga hanapin din minsan natin si Dr. Although important na, pag okay na, administer na natin. At pag mababa, syempre, we provide precautions. Mag-check ng BP syempre. Okay? So letter A po tayo dito. Mag-clarify kasi nagkakagulo. Okay? So that is the most appropriate. At mas safe, right? Kasi it's about safety. Okay? So letter A. Next. So very good. So letter A. Alright, so patient, si Nurse Royce ay isang medical surgical nurse receiving a report. Ayan, mga true to life stories to. Client are being admitted for cellulitis of the right leg pero may hypertension or there is an elevated blood pressure. What is the priority? Ayan, prioritization naman tayo. On what question should we ask further? Did the client get any medication for the BP? So, syempre, nasa chart naman yan, right? Although, maganda rin magtanong-tanong minsan, pero baka, syempre, dapat, mag-chart review syempre muna tayo. And this, it should be searchable naman sa chart. And then, may symptoms, right? May hypertension. So, it is not necessarily at this point. How often, ayan, magbibigay pa tayo ng antibiotics. So, hindi directly related, but baka may cellulitis actually. Pero, di ba? May hypertension ang focus natin. Okay? At nakikita rin naman yan sa chart as well. What was the last blood pressure? This information as well, nakikita naman natin yan sa chart. Siyempre, mag-endorsement din naman, but it is not the priority discussion of this patient. Ayan, tatanungin natin. Next, siyempre, experiencing hypertension. So, asking the patient kung may further, may mga symptoms, ano pa yung mga, related symptoms niya, ay may dizziness pala, ay may headache. So dapat na-address na rin na to sa emergency room or something like that. But yung priority here is to clarify. May symptoms pa ba si patient ngayon? Is the patient symptomatic? Ayan, kailangan kung meron, kailangan syempre ma-report agad din as well. Kasi syempre pag may mga ED, nurse, kailangan stable na yan pag pinakyat sa ward. So letter A is much more the better priority questions here. Okay? So letter A. Clear? Heart naman dyan. Kung nandyan pa kayo. Ayan, nandyan pa kayo. Ayan, ito madali lang. Ayan, although pulse pressure pala tinatanong dito. So, yung iba pwede mag-chat sa chat box. Ayan. So of course, important din ang pulse pressure lalo na may mga doctors nagpapacheck ng pulse pressure or kasama sa vital signs yan at i-compute nyo yan. Siyempre, it's a simple computation. What is pulse pressure? Siyempre, it might, it could be a prediction that a patient may have a heart event or, ayan, risk for heart or cardiac related disorders or even stroke. So 128/80, syempre normal yan. It's in a normal or stable level. And what is pulse pressure is SBP minus DBP. And the answer is letter. Anong sagot mo? Letter B. Letter B. Okay, 128 minus 82. Siyempre, 46 sagot dyan. So the pulse pressure could indicate there is a cardiac disease or if it's elevated. Yan. We don't know what is elevated, but in terms of, knowing the status, pag mga 60 and above, probably there is a higher incidence of, cardiac related disorder or disease or even stroke. Okay, especially for the adults. Okay, ayan, check natin yan. Okay, that is 128 minus 82. Clear? Heart? Kasi minsan sa board exam may mga computations actually dyan. Even IV fluids, mas important din yun. Okay? And dosages. Ito. Last question for the hypertension. Ayan. 141/90, syempre, it's elevated. Normal, it's not regulated, right? 120/80. Stage 1, what is stage 1? Sino nakakaalam? Stage 1, according to IHA, is stage 1, 130 to 139. Tapos 82, 89. Mga pre-hypertension, syempre, yung less than, ito, 130 over ano. And then stage 2, ilan? 140 and 90, right? Pataas. So that is on the range of stage 2 hypertension or letter C. So this level indicates you are in hypertensive stage 2 ko. Kailangan mo uminom ng gamot at mag-comply sa medications. Okay? Although, syempre may mga target range sa mga patients, especially depende yan sa doctors. Pag mga diabetes, medyo mataas, okay lang yun, pero kailangan mag-medication management. Syempre, yung pinaka-concerning dito is yung hypertensive na sobrang taas, 160. Tapos may mga conditions pa siya like dizziness, hypertension, or headache, right? So ayan, kailangan alamin mo kung ano yung target BP range. Kung medyo nasa stage 2 hypertension at nandyan pa yung range, continue lang yung, medication management and lifestyle changes and everything. So, pero pag syempre, may mga target range, dapat medyo mas okay, mas mababa, and then, or something like that. 140/90, kailangan hindi ka tataas dyan, okay? Kailangan gumamot ka pa rin. As better, bumaba yan, okay? Just to, quickly identify, syempre, we talk about many things about hypertension, and then these are really important to decrease risk for, or risk or prevent complications like complications. So, yan. These are mostly, yan, dapat, talaga, yung BP meds, Minsan hindi mo na pinagsasabay. So depende yan. Minsan inaano yan, tinitimpla yan. Ay yung isa sa hapon or yung isa or minsan sabay pa yan, or yung isa sa lunch. So dependent yan on that instruction as well. Assess any organ damage. Meron bang ano, namumula yung mata dahil nga baka may ano na or something else like dizziness, headache, neurologic na pala, stroke. And assess, diretso yan, diretso. Chest pain, dizziness, headache. We need to promote yan, mga DASH diets. So it's a low sodium diet and then balance on the veggies, tapos fruits. Siyempre, kasama pa rin yung mga carbs and something like that. BP screening, kailangan mag-check talaga ng blood pressure, lifestyle, kailangan at least kung hindi masyadong malakas, siyempre ano pa rin, kahit brisk walking or something like in the bed, maggalaw-galaw siya or baka kailangan ng therapy as well. So kailangan mag-follow up talaga kay doctor at even even every 6 months or annually punta siya ng health center. At really important din what is beyond or low the normal, di ba? Baka may hypertension, kailangan mo na siyang magpahinga at bawal tumayo ng mabilis, di ba? Ano muna, chill lang muna, raise slowly. Okay? Maganda rin mag at-home BP monitoring, just like we are doing in telehealth, right? Yan. Reduce weight din, syempre, lalo na yung mga patient with obesity. Okay? Walang canned foods, walang processed foods as much as possible. Pwede rin, basta continue medication management. Alright. Sige, let's have a quick 1-minute break. Hanapin niyo yung heart. Kuha lang ko ng water. Sige. Let's find the heart. Sabi ni Jareen, yan daw yung heart. Hindi yan yung heart. Yan, tama. Sabi ni Erica, Joyce, heart. Nika, Giovanna, Sofia. Uy, nandito kayo. Moriko. Ayun. Ano talaga, yung heart talaga yung nakita. Ba't ganun? Naging ano siya? Iba yung the picture. Alright. Heart. Sino yung nauna? Si Erica. Erica Devi. Alright. Good. So let's move forward with myocardial infarction. Nababasa niyo yung fonts? Baka kasi parang nag-iba yung fonts. Nakikita niyo yung font? Yung
Yes, sir.
okay. So we're talking about right now MI. So which is a sudden restriction of blood supply of the heart. So, syempre, it causes ischemia and death to the muscle tissues. So, when we think about MI, right? So, I want you to think vascular disorders. So syempre, if you remember from the anatomy, syempre, we have that coronary arteries. So as you can see here, and then coronary arteries that supplies the heart with, you know, heart muscle with blood. Yan yung vessels natin. And then if one of them gets blocked, probably baka sa plaques or pwedeng clot. So syempre, nagkakaroon ng occlusion, di ba? Syempre, pag may occlusion, nagkakaroon ng, blockage. At, it is dying, or yung mga cardiac cell, di ba, is dying. So as you can see, the blood cannot flow. The blood cannot flow. And yan nga may occlusion, right? Syempre, beyond that, syempre, the occlusion and the related tissues on the heart is dying. So the problem here is syempre yung vessels, so block vessels. Syempre block yung blood flow. Blood flow. Okay? Block vessels, block blood flow, and it's a vascular disorder. Ayan. So how do the patients or our clients present? So syempre, the classic sign, syempre yung mga crushing chest pain, at it is probably unrelieved by rest. So sasabihin nila, or minsan sinasabi ng mga nurses, may nakadagan, or may nakadagan po bang elepante? Or sobrang bigat po. Ganun yung mga sa practice ko, ganun ako pag sa sobrang bigat, ganun po, ay parang may elepante. Diba? Sitting on their chest. And yan, if this chest pain is relieved by, if ever may nakarelieve may mga nitroglycerin, pwedeng yan, probably angina. But this pain can also, of course, radiate, usually sa left side, sa arm, tapos sa back, tapos sa left shoulders. So yan, sa other literatures, or yan, mga patients sa women, may sila epigastric or jaw pain, or left jaw pain as well. Okay? So pwede rin due to heartburn, or they may complain nga yan, epigastric or jaw pain, or heartburn na tinatawag din. Okay? And then yan, it is unrelated yan to an activity like makain, umiinom, or positioning, or even breathing. So, yan, patient will be often mahirapan huminga, shortness of breath, tapos pale, sobrang putla, tapos pinapawisan, mottled skin, even nauseous, right? And many times, syempre, anxious sila. And then, feeling nila, tumakas yung heart rate nila, palpitated. It's really important to know that pain shouldn't be, related to the activity. So when your patient having, this kind of symptoms, we need to do thorough assessment. At kailangan talaga we set or check yung mga vital signs natin, kailangan mag-EKG, ECG, and then as well as medications. Okay? Probably pwedeng hypotensive, pwedeng bradycardic, at may ST elevation on 12-lead ECG. At mataas yung mga cardiac markers or mga cardiac enzymes. Troponin, ayan, elevated. Ay mamaya, madidiscuss ko pala yung mga values. So yan, kailangan further chest pain, assessment, vital signs. Listen, syempre, pa rin kasama yan, mga auscultation, and then report to the healthcare providers. So just an overview, syempre, we are talking about MI. So both have yung isa NSTEMI, saka STEMI, crushing chest pain. So both do have crushing chest pain and other symptoms. And of course, both will have elevated tropi, CKMB, myoglobin, so elevated cardiac muscle or enzymes. ST elevation and walang ST elevations. So it is locations specific. So this is to give way na ano ba yung involved na artery. So syempre pag STEMI, ayan, there's an occlusion, or there's a complete occlusion of the coronary artery. And of course, it requires an immediate intervention. Kailangan ng mga thrombolytics, mga surgical intervention, and most of the time dapat, ano na yan, minsan dapat diretso na yun sa mga cath lab, kailangan na ng mga angioplasty, or baka may stenting na tinatawag. And then sa non-ST, syempre there's a partial occlusion. So, pwedeng sa medication management, pharmacologic therapy, or ano lang, check yung further, angiography nila. So, really important yan. So, syempre, kasama yan. Protocol lagi yan, may ECG. Okay? So, depending on how stable they are and depending on the doctor's order as well, or management. Or baka kailangan na rin ng specialist, mga diba, cardiologist na tinatawag natin. So yan, when we talking about diagnostics, syempre, these are some of the few enzymes we look at to determine cardiac muscle damage. Troponin I, these are the normal values. So depending on the laboratory at depende rin sa on the what device should use, what use. CKMB 5 to 25, myoglobin 25 to 72. Syempre, anything about really high elevated, probably related to, it's about, syempre, pag mga elevated yan, di ba? There's is, cardiac muscle damage, right? Cardiac muscle damage. Yan. It peaks on, yan, usually within the symptoms. 2 hours, peak 12 hours, peak 10 to 24 hours on CKMB. So, of course, even we don't know about the peak or something like, we just know about the, elevated. Siyempre, it really peaks lalo na sa mga patient may mga heart condition like MI, okay? So, important yan, specific. And then, even the next few days, medyo nag-elevate pa rin. Pero, after 1 day or 2 to 3 to 5 days, dependent with the patient, right? Nagana na siya, normalized or medyo elevated pero hindi naman much better. Baka kasi nagbigay na ng mga treatment as well. Okay? Ayan, syempre ECG is really, really hard sometimes. But when we look at a 12 lead ECG, 12 lead, 2, 3, ABR, ABL, ABF, B2, B3, and B4, B5, B6. So, syempre, hindi masyadong na mga as student nurses, right? Especially yung mga dapat yung mga nasa cardiac or nasa ED or nasa heart station, magagaling sila mga dun ECG, right? But we want looking at this image, you have this 12 lead ECG yan, mga lead, mga na yan. And it's really, important here na, how to distinguish ano yung MI dito. So, really important yung, on the aspect of the leads here. This one, and 3, ABF. And really important yan, parang sapatos, right? So, yeah. Although this is a normal ECG. And then we have other things like, yan, ABL and something like that. So really important yan dito yung inferior natin or anterior leads na tinatawag. So remember, yan nga is really important. Inferior leads. And then the rest anterior yan. Something like that. So that is a normal ECG. So pag sa STEMI, ayan, we talk about the important here. So yung iba kasi is medyo normal or really confusing, right? You'll notice yan, may ST elevation, right? ST elevation. Taas yung ST. Yung PQR ST is really magkadikit na actually, di ba? So ST is elevated here. So these are the little boot, right? Or yung sapatos, inferior leads. And then the rest are also yan on that side. So it's important to note yan really inquires mga depende yan sa treatment ng patient. Like this one, may patient na inferior MI, so depende on the interventions. Okay? Sige. I hope we will have a separate discussion on the ECG. Okay. Siyempre, sa therapeutic management, so alam natin yung MONA. Di ba? MONA. MONA. What is MONA? Of course, yan, sulat na natin. Morphine. Although yung iba nandito mga level 1 pa rin. So, probably, yan, dapat alamin nyo natin yan. Okay? So, morphine, siyempre, it will relieve the chest pain. So, pero kasi usually nitrites mo na inuuna, right? So it will dilate the coronary vessels. So dilation. So pag nagkaroon ng dilation ng coronary vessels, so there is an increased blood supply. Blood supply. Okay? So pag hindi na-relieve yung nitrates, nakatatlong dose, 5 minutes apart, right? Lalo na pag sa home settings, pag naka-first dose, hindi pa rin naka-relieve, much better dumiretso na din sa ER or sa emergency. Or habang natatapos yung 5 minutes between apart, na siya, ma-report na niya agad. Pag hindi na-relieve, mag-morphine, okay? Mag-morphine. Tapos, syempre, lalagyan siya ng oxygen para, increasing oxygenation will, reduce the myocardial demands. Myocardial demands. At aspirin, of course, important din yan, di ba? It's an antiplatelet to reduce also the mortality. So may mga patients tayong indicated din mga inferior MI. So hindi pwedeng hindi na-relieve sa mga nitrites or sa mga morphine or opioids. So kailangan mag-oxygen or fluids or other medication management. And yan, syempre protocol lagi, di ba? Monitor EKG. At kailangan syempre magpahinga to decrease the O2 demands of the heart. Kailangan lagi tayo nag-anticipate na orders. Ay, may chest pain. Hindi mo na hintayin yan magpa-order kay doctor. Saka na lang isusulat yan. Ay, chest pain. Kuha ng ECG. Pasok sa room at i-check. Or magtawag ng kasama. Kasi syempre, kailangan mo, hindi mo hiniiwan si patient, right? Ayan, check na yung cardiac enzymes, troponins, CKMB, saka myoglobin. Yan. So, if, thrombolytics is needed, so, ayan, kailangan i-prepare natin si patient sa pagbibigay niyan. And yan, meron tayong mga PTCA or percutaneous transluminar oroangioplasty. Okay? So, para at least prevent further yung MI. So, really important then, yan sa inferior MI, magbigay ng mga fluids as well to boost the preloads, tapos improve yung cardiac output. Okay, so that's about MONA. Okay, ayan, as nurses, syempre dito tayo lagi, di ba? Education, diet, yan, babaan, ayan, lagi na natin decrease sodium, decrease cholesterol, diba? Mga iwasan na yung fast food, even sugar, mga soda, mga processed food, coffee, anything na mga bisyo, alcohol. Exercise, important pa rin yan, galaw-galaw pa rin, diba? At least less than 1 hour, 30 to 5 per minute will do as instructed or as tolerated. Kasi yung iba nagre-rehab or nag-cardiac rehab, tinatawag doon, or therapy, pwede rin yun, okay? So, yan, mga patient natin, syempre, there is dapat tolerated nila yung activities nila. At dapat wala rin sila mga underlying symptoms like shortness of breath or, cardiac complications, at cessate with smoking or at least stop na talaga. Okay? Medications, sublingual, usually ang nitroglycerin, although may mga oral form or may IV form, pero mas madali, di ba? Mas convenient ilagay sa baba ng dila, right? 0.4 milligrams with chest pain for 5 minutes apart 4 times a day. Pag hindi na-relieve after 1 dose, emergency na or 911 or yan. Syempre yung Viagra is also, diba, sildenafil is also an anti-hypertensive drug. So syempre, mga patient din, mga lalo mga talanda or mga men, right? They also take it. So kailangan hindi sila nagtitake or as needed or dependent on the instructions. Okay? Aspirin, Normally 81 milligrams, pero pag nag-loading sa ED, triple na 325 milligrams. In-increase na yan, or 3 tablets as well. Yan, usually aspirin yan. Sa lunchtime, dapat medyo talaga, puno ang tiyan kasi syempre nakakasira din yan ng mga lining sa GI. So kailangan, usually yan, binibigay ko yan sa mga patient na lunchtime as well. Or nilalagay ni order, lunchtime, diba? And when to call to provider, syempre, pag hindi na-relieve talaga, diba? Kailangan, talaga, emergency na yan, or it is really relieve. Tapos, may syncope pa, may matay, or may evidence of bleeding pa. At hirap na rin, gumalaw-galaw. So there's a bleeding risk as well, syempre. And then really important dahil nga may patient, may mga anticoagulants, right? So kailangan i-check lahat ng symptoms. Okay? Sige. Question na tayo para Alright, patient, si nurse, nasa ED, syempre, complaining, my patient are all complaining of pain. Syempre, uso yan lagi. Pasok, may symptoms like pain, diretso agad sa ER. The nurse knows the client which of the following priority. So, prioritization. Okay? Lower abdominal pain. So, pwedeng may kidney problem or kidney infection. So, syempre, lahat naman yan kailangan i-treat, right? So, syempre, kailangan unahin kung ano yung pinaka-priority. Bilateral flank pain, pwede rin kidney yan. Lower back pain, ayan. Lower, naman, sa likod naman to, lower back. Syempre, concerning yung jaw and neck, right? Especially, yan, nag-radiate pa sa jaw and neck. So, it is really a priority here. So, probably is suspected with MI, especially sino yung mga patient na yan? Female, di ba? Mga jaw and neck, according to mga studies. So, the client should be seen first to rule out MI. So, letter A. So, correct kayo. Nakikinig kayo. Next. Pain medication like nitroglycerin, morphine, experiencing pain such as, of course, MI ang topic. Which factor would be the nurse mostly likely considered when giving pain medication to patient with MI? The client needs to sleep. Ayan, important naman talaga magpahinga. But it's not a requirement, di ba, of receiving pain medication. Pwedeng affect na rin kasi minsan, di ba, may pain medication like opioids, antok, then it may relax them. But it is not a, requirement. The client should learn to notify the nurse if the patient is working nga right? Baka if it's not working, right? The client is at risk for aspiration or aspirating the medication. Although maliit lang naman yung tableta na yan, probably they would, especially mga patient na maraming iniinom, marami ang patient, 20-20 yung tableta, so spacings yan, tapos minsan naka-NGT na lang or nahirapan, or siyempre they have risk of aspiration pero it is caused by some other factors, intrinsic factor tawag doon, di ba? But that is not the medication itself, okay? So letter A yan, yung pinaka-priority at best answer here because we're talking about MONA, right? So dapat may oxygen na rin sila para, to decrease the cardiac demands. And really important yan, okay? To monitor. Vital signs pa rin at yan, morphine nitroglycerin, yan. Oxygen. So the nurse should recognize we could give oxygen. And pwede naman i-order yan later on, okay? At least 2 liters. Kasi sa sobrang taas, kailangan talaga i-order yan pag sobrang taas pa, okay? And yan, pwede rin mag-check na pulse oximetry and vital signs, of course. Reassess, important yan after giving medications. So letter A. Eto. Sata. Sige. Bigyan ko kayo ng oras. Game. All right, so may patient probably with MI, pero normal sinus rhythm, NSR daw. Patient with lab work results, pero elevated daw ang troponin. What is the priority or what are the priority interventions? So you mentioned letter A, yung mga pinakamarami dyan. Sige, let's talk about redrawing troponin. Kailangan ba i-redraw ulit-ulitin ba ang troponin? Kaka-start, lang, kuwal lang. Siyempre, for sure, elevated lagi yan. Or yung elevated yung enzymes like troponin, CKMP. So may specific interval yan. Hindi agad-agad yan. Baka after 6 hours or after a day. Siyempre, redrawing the troponin level is inappropriate kasi kakakuha lang, right? So mali na agad ang number 5. Ay, mali na lahat. Yung number 5. So yan, minsan pag alam mo ng mali right? So we mentioned yan, notify MD syempre. Kasama pa rin yan. Although kailangan mong i-re-evaluate yung chest pain kasi nga after 30 minutes pa, right? So sige, check ulit natin ang chest pain. Tumaas ba? Nag-subside? Or is it worse? Or is it better? Or same pa rin, right? So it is possible the patient can be having, even it's a normal sinus bleeding, and STEMI, sinasabi natin diba, mga pwedeng and STEMI. Re-evaluate chest pain, repeat EKG, yan, important yan. The patient may have non-STEMI, pwede rin, di ba? So, i-check pa rin yan if there are any changes that occur. Morphine, oo, important din naman yung pagbibigay ng morphine, but kailangan mo nang ma-reevaluate, di ba, bago, on the fact na kailangan alam muna ni provider actually, although I didn't mention a while ago, pero kailangan muna ma-check rin yung mga EKG or yung lab results pa rin bago magbigay ng medication like morphine. Kasi ang morphine, second pa yan eh, di ba? Probably we could assume baka nag-nitroglycerin muna yun or aspirin. Saka ang morphine sobrang tindi niyan. Kahit lang yan, parang drop of fluid eh. Lagi ako marami nang nabigyan na patient na may morphine eh. Sobrang liit lang, parang point something lang. So, kailangan i-check talaga yung mga EKG and then later on, magbigay ng morphine. So, kasi ang morphine, nakakababa rin naman yan ng blood pressure. Baka it could cause significant hypertension. So it's really difficult to know this information. Di natin alam kung STEMI ba dyan or STEMI. So bago magbigay ng kailangan alamin na kailangan mag-repeat ng EKG after troponins. Okay? Para mas safe yung pagbibigay ng morphine. Okay? So 2, 3, and 4. Letter B. So may 90 na nakatama. Okay? So kailangan mag-check ulit ng ECG at check, ma-verify yung lab work, right? So kasi minsan may mga inferior MI, right? Hindi maging effective ang mga MI sa mga inferior MI or yung morphine na tinatawag. Okay? Baka kailangan ng fluids muna at this time, okay? Or ibang pain medication. So letter B is the right answer here. Clear heart. Clear. Diyan pa kayo. Ayan. Diyan pa sila. 8, 11 ang nag-heart. Ayan. So we're moving forward, although it's still, directly related with MI, but it's still chest pain associated with a lack of adequate blood flow to the heart muscle, right? So this may be because of, existing diseases like coronary artery disease, pwede rin sa stress, pwede rin sa anemia, pwede rin heart failure, mga abnormal rhythms, arrhythmias, stress, and overexertion. But the number one goal here, syempre, we restore the flow of the heart muscle or to the myocardium, right? So, they often present chest pain pa rin, mid-sternal chest pain, and still, radiating to the arms, like the left arm, even the jaw, right? So there are types of angina, even stable, syempre, with exertion. So probably pwedeng ma-relieve sa nitroglycerin. Unstable, syempre, may really relieve at rest, but kasi nga it lasts longer, right? So pwedeng hindi ma-relieve sa nitrogly at variant, so it is unpredictable. So what is important here, syempre, kahit kalimutan nyo na yung ganun about the onset, but thinking that we are talking about assessment, kailangan check natin yung, further what is kind of chest pain is that. We need more assessment about information. So pwede tayo gumamit, di ba? PQRS, all old cards na tinatawag. Old cards. So as nurses, lagi ako pag nasa kausap yung patient ko, lagi ako nag-old cards actually. Although PQRC, maganda rin naman yan. But mas, gusto ko yung old cards. So onset, right? Kailan nag-start ay just this morning. L, location saan? Chest. Tapos radiating to left shoulders. How long or the duration? Ano na pala? Or gaano katagal na? Ay, 2 hours na pala. Or dinidibdib niya or dinadamdam niya, right? Character. ano yung character? Anong klaseng pain? What does the pain feel like? Sasabihin mo kay patient. Or ano po, i-describe niyo po yung pain niyo. Ay, crushing pain pala. Crushing chest pain. And A, ano yung A? Aggravating what makes it worse and alleviating what makes it better. Ay, wala pala. Hindi, ano, it's constant, nothing, laging worse, something like that. At, it's constant daw sa pain. R, pwedeng radiation. Ayan, sinabi na kanina sa location, right? It is radiating, radiation, radiating to, sabihin na natin left arm. Timing, yan, sabihin natin, ay, timing, hindi naman like time, right? Pwedeng dahil during the activity, ay, habang kumakain, or habang naka-flat on bed, or something like that. Or is it associated to anything about anong klaseng timing? Or sa umaga lang ba? Or sa hapon, right? So, constant pa rin daw yung chest pain. Severity, alam na natin yan, di ba? How do we do our severity? Paki-chat, how do we do our severity factors? Relieving factors, oo, pangyari, ay narelieve pala sa rest, mapahinga. Ayan, pain scale, of course. 0 to out of 10, pain scale. Face, pwede rin face pain scale kapag mga patient with mental disorder or may visually or hindi sila maka-describe, something like that. Okay? So 0 out of 10, sabi niya 10 out of 10 pala. 10 out of sobrang severe yung pain na niya. Okay? So yeah, kailangan marunong kayo mag-assessment. Lalo na sa ER pag ni-rotate kayo. Actually sa med-surg lagi ko yan lagi ako nag-assess. Of course, vital signs, check na rin, diba? Kung elevated yung blood pressure, lahat na pala matataas. EKG, or mag-check ng EKG kahit hindi ka marunong mag-read, okay? Important yan. Are there any other symptoms on, are there any dyspneic ba siya during exertion? Nag-take na ba siya ng nitroglycerin or aspirin? Ay, hindi niya alam, wala siyang dinetake pa. So, something like that. So, syempre, there could be a concern, right? Syempre, at that point, kailangan, hindi lang vital signs, heart rate, pulse oximetry, important yan. Syempre, nag-chest pain, right? Kailangan mag-ECG. I-check natin yung blood pressure. Pag mataas, baka there is a decreased cardiac load or cardiac output. Syempre, pag hypertension, stress yung heart natin, right? Lalo na sinabi ko kanina, hypertension, o sobrang taas pala ng heart rate, 142 na rin. Mababa na rin yung SATs, auto-SATs, 93%. Di ba? By checking this information or in this assessment, really important yan, like, ay meron pa rin pala oxygenation issues. Although 93%, medyo mababa na actually, pero still stable pa naman yan on that side. Pero kailangan ng oxygenation, right? EKG, baka may arrhythmia, marunong ka pala alam mo na yung mga tawag dito, sinus bradycardia. Siyempre, pag may sinus bradycardia, mababa yung cardiac output, or yung SVT, may stress sa heart, di ba? Mga suprapubic tachycardia, mataas yung heart rate. Ay, may atrial fibrillation din pala. So, may increase yung stress yung heart pa rin, di ba? Anything about arrhythmias. Ay, may mga other symptoms pa pala siya, mga diaphoretic, excessive sweating, or syncope. Ay, it's nag-faint out na pala si patient dahil nga baka may bumababa or sa autosat or something like that. Okay? Siyempre, pale din si patient. So, assess first. Ayan, something like, the main intervention here, what do you need, yan. Muna ulit. So, inuna ko ulit. Namo nga, namo. So, yun na lang, namo. Nitroglycerin. Kasi morphine, IV yan eh. Di ba? Although merong mga oral forms, pero hindi ka makakakuha agad na ganyan kasi it's a regulated drug, right? Ang nitroglycerin pwedeng, regulated but kailangan order. But mas mabilis, syempre, makakuha ng nitro and aspirin, right? This time, syempre, nitro, really important yan. Kailangan oxygen, 2 liters. Since the patient, O2 kanina, 93%, 93, appropriate to apply 2 liters. Tapos, powder na natin, Doc. Nagbigay na ako ng 2 liters. Okay, heads up mo sa kanya. Nitroglycerin, hindi nakarelieve ulit ng 1 dose. Diba? At least 3 doses, 5 minutes apart. It's a vasodilator, right? And then aspirin, yan, antiplatelets. Pag hindi na-relieve ng nitroglycerin, magmomorphine. Kailangan continuous reassessment mo. 10 pa rin, hindi pa rin pala na-relieve. Kahit may oxygen na rin. Enzymes. Ano yung mga enzymes ulit? Pakitype. Cardiac enzymes. Alam na yan ng mga 4th year for sure. Yung mga 4th year, 3rd year. Enzymes, correct. Troponin, ayan, perfect. So marami pa enzymes actually. So yan yung mga basic ones. Okay? Yan. Of course, siyempre, appropriate yan. Rest. Decrease myocardial demands, right? Auto demands. Kailangan pahinga. Siyempre, hindi mo, bed rest lang yan. Complete bed rest as much as possible. Kung medyo stable na, later on, pwede naman mag-stress test, right? And then, important yan to rule out and to give further management to that patient. Ang ultimate goal nito, syempre, is to reverse the cause and restore the blood flow to the heart muscle. And syempre, pag hindi tayo nag-act quickly, baka maging advanced na yan. Diba? Mas advanced kasi, diba, yung easily advanced to MI, right? And knowing what to do in order, it will be, maging proficient tayo. Marami na ako ng patient na ganyan, nag-chest pain, nag-angina na pala. So, kailangan bantayan nyo si patient. Kahit nasa med-surg ward kayo, 20 yung pasyente nyo, prioritize nyo yung mga unstable, right? Pakuha ka ng ECG. Ako nga minsan, ako yung lagi utosan sa ECG kasi gusto ko talaga yung nag-ECG. Punta ako dun sa heart station. Kahit medyo malayo or minsan, inutosan namin iakyat. Kaso hindi nila makyat, madidelay yung care. Kasi minsan, ang mahal ng mga ECG, right, hindi naman lagi available sa station. Pupunta ako sa heart station, may mga tropa ako dun. Kukunin ko, akyat ako dun sa balik kay patient. Okay? Really important yan. Ayan, syempre, really still stressing and patient education, weak class surgery activities. Kailangan may rest periods, lalo na medyo stable na si patient, right? Pwede naman gumagalaw, but for sure, dapat pahinga rin siya. Okay? Daily aspirin. Okay? As ordered. Nitrogly, kailangan i-educate natin si patient kung paano mag-take ng nitroglycerin sa sublingual. 3 doses, 5 minutes apart. Pag nasa bayan, lalo na pag hindi na relieve. Lifestyle changes, I already mentioned about and reiterate that on the hypertension sa MI, exercise as applicable, di ba? Moderate or vigorous or at least, galaw-galaw rin pag may time. Okay? Weight loss, ayan, lalo na mga patient with obese, stop smoking, stress, pwedeng turuan nyo baka marunong kayo mag-yoga, meditation, di ba? Mga therapy, music therapy, at mga pet therapy, right? Yung iba sa mga pets. And kailangan they keep records on the events. Kailan ba sila ng chest pain? Ay, na-relieve pala. Okay naman pala. Or bigay natin yung contact number natin. Sa telehealth, alam nila yung number. Bibigay ko yung PIC number. This is my number. Please call me if you have any symptoms. Or if it's emergency, please call 911. Ganun lagi kinasabi ko sa pag mga patient ko sa telehealth. Okay? Alright. Sige. Much more on that. Let's see this one. Alright, 74. At may sumugot ng letter D. Sige, let's see. Patient. Ayan, may ER, lagi may chest pain. Sino ang unahin natin? Mataas. May chest pain pero mataas yung heart. Ay, mababa. X na muna yan. Saka ka na. 0. Pero na-relieve naman pala. Okay na siya. Stable na siya. 610. Although motor vehicle accident. Although hindi sinabi kung ano yung neurologic symptoms, right? Baka probably, ayan nga, may accident lang na chill lang 6 out of 10. Pero we're talking about they are both emergency pero walang sinabing kung stable kasi kulang yung information. But we are prioritizing both of the patient, but we are talking about our topic about angina and MI, right? There's a chronic chest pain at may diaphoretic pa, right? There should be a priority of these patients. While each clients, yes, they are somewhat urgent, right? And the chest pain with indicative of diaphoresis is an indicative of the pwedeng acute MI yan or yan. Therefore, kailangan immediate. Pero syempre pag sa ER, lahat yan ipa-priority naman actually. Ilalagay yan kung saan, okay? Kasi na-rotate lang din naman ako sa ER sa PGH. Yan. Although ang dami pumapasok kailangan talaga yung iba, pag hindi stable, sa ibang hospital na. Kasi sobrang puno sa PGH. So letter A muna tayo, okay? Siguro A next natin. Pero syempre ideally, sabay-sabay naman natin yung gagawin. At ibibigay sa ibang nurse at providers. So letter A for this situation, okay? For situation. Next. Clear tayo, nandyan pa kayo? Heart. Sige, nandyan pa kayo. Si G. Marla nag-heart. Ayan, may nag-heart. 16. Sige, okay na muna siguro tayo. Yung iba sa chat box. Patient with angina, nagna-nitroglycerin. What is nitroglycerin? Blood clots. Ano yan? Wala namang anticoagulant effect ang nitroglycerin. Minimizing atherosclerotic plaques. Wala namang it will not improve on the concept of plaques. Sabi baka ang mga atorvastatin, statins, increasing blood pressure. But it is di ba? It's a vasodilator. But not a vasoconstrictor. So it will not increase the BP to improve blood pressure as well. But, importance yan, di ba? There's a dilation or vasodilator yan. Dilating the blood vessel. So, bakit? Siyempre, really important yan to improve the blood flow. Tapos yung control ng symptoms of angina. At yan, may patient na may cardiac ischemia, right? It will help dilate the blood vessels. Siyempre, yan, yung mga coronary arteries natin. So, letter B. At thereby, it will increase venous return. Increase venous return. Okay, letter B. Clear. Heart. Clear. Patient having or struggling with dyspnea, may chest pain, difficulty of breathing. Which of the following measurements could indicate struggling with dyspnea? Dyspnea, syempre, autosat. Normal pa naman na autosat actually. Okay, it does not indicate concave abdomen, not related to dyspnea. Dry hot skin, baka dehydrated or pwede ring mga heat stroke or mga diabetes insipidus. So depende yan. But it does not indicate it. At saka ito yung pinaka-concerning, right? Elevated ang the rest okay pa naman, but still kailangan pa rin ma-check yan. Okay? 25 RR. Alright. May associated with nasal flaring, use of accessory muscles, sobrang taas ng RR, right? Cyanotic, di ba? Pwede yun. So letter A. Next. Ayan, nitroglycerin. Sublingual. Which one is correct? Full glass of water ba? Diba? Nadi-dissolve naman yan. Sobrang lit yan. Ganyan kaliit. Pink yan. Color pink usually yan. Sobrang liit yan. Place the tablet in your cheek. Sa gilid ba? Put the tablet on your tongue for 1 minute. Then chew and swallow. It should not be chewed, right? Naman yan eh. Dissolve. Okay? It's a small tablet, but it's a life-saving medications. Okay? It will dilate the blood vessels and then maganda yung blood flow. At yan, it will effectively treat mga chest pain. Kasi nga, ida-dilate niya yung coronary arteries, right? So, sublingual, dissolve on the tongue. Do not chew, do not swallow. Okay? Mas maganda yung therapeutics and effect niya. Okay? So, letter D. Sige, mag-break lang tayo ng 1 minute. I'll just take some drinks. Ito rin ba yung kanina? Ay, hindi, parang iba yun. Sige. May nauna kanina, hindi ko alam kung sino yung nag-type ng sulat dito. Sino yun? Pero sabi ni si Nika. Oo, yan nga yun. Tapos, yan. Sabi ni Ali. Sino kaya yan? Hindi ko napansin kung sino yung sulat. Anyway, alright. So, let's proceed. Ay, kita ba yung screen ko? Sige. Ayan. So let's move forward to another discussion. Let's talk about heart failure. So ayan, although we're reviewing this concept for my previous lectures sa may mga students ko, but really important, especially sa board exam. Heart failure, of course, there is a pump failure. Pump pump failure. So occurs when the heart cannot pump enough blood supply or enough blood to supply the body's needs. So syempre, maraming patients na may ganyan din. So what exactly causes heart failure? So marami yan, di ba? There could be a decreased perfusion and then increased congestion. Later on, we will discuss this. And then may mga thickenings on the ventricular chambers. And thereby, di ba, nagkakaroon ng smaller filling capacity. So one of the causes could be MI. Yan, that is one of the two top causes, MI saka hypertension. At even valve disorders, it could cause a lot of problems too. Dead muscle or yan, MI, di ba? Kaya kanina, important din yan, okay? Remember, syempre, there's a cut-off to the heart muscles. And then, syempre, yung muscles die, especially yan, mga patient with MI, and there's, probably may problem sa contractility, di ba? So there's a pumping ability that is really, affected. So, yeah, mataas ang hypertension or blood pressure. So, mataas yung afterload. So, pag heart has to pump harder, syempre, yung high pressure in the vessels, nagkakaroon ng mga, pump failure as well. And then, of course, there's an impact too. It could cause, mga disease like heart failure, and it affects the heart muscle. So there are multiple ways we could diagnose, but we're not, diagnosing naman actually, but we could anticipate that this diagnostics will be ordered by the providers. Okay. BNP is also a enzyme, but syempre, itong BNP na to is released when the ventricles are, stretched, yung mga ventricles. So, tumataas yan. So, dependent on the, laboratory, usually normal is less than 100. Minsan, pag sobrang taas na, even na 800 na, right? So, iba-iba kasi ang, severity ng heart failure, right? So, yan, more than 100, pwede na. But on the side of it, we need to know other signs, symptoms, or diagnostic. Cardiomegaly, sobrang laki ng heart. Tapos meron din pulmonary edema. Okay, sa X-ray. Okay, cardiomegaly, malaking heart, and then may edema. And then sa echocardiogram, kailangan din mag-echocardiogram. So, yan. May problem with the ejection fraction, usually less than 50%. Makikita dun sa result. Usually yan sa mga may heart failure. And it could also further diagnose valve disorder, yung mga echocardiogram. Okay? Sige, BNP, X-ray, echocardiogram. We're talking about, syempre two kinds, left-sided and right-sided. Sa left-sided, there is an increased pulmonary congestion. Pulmocongestion. Sa right, there is a increased systematic congestion or decreased pulmonary perfusion as well. Tapos increased systematic congestion. Tapos sa left, pwede rin may decreased systemic perfusion. Although, yan, nakakalito yan, but ano na lang, tandaan nyo, although na-discuss ko na sa abang student ko yan, lung concerns, lung. Although sa right, pwede rin naman may lung, but we're talking about ano na lang, differences. Retention, R. Yan na lang yung mnemonic nyo. L, left to the lung, right, retention. So, ano meron sa patient with left-sided heart failure? So, yan, lung concerns, right? Sa gabi, there is a paroxysmal nocturnal dyspnea. And then yan, inuubo, may crackles, sa panoscultation, blood tinged sputum, tachypneic si patient. Orthopneic. Both of them, syempre, pagod yan, maraming symptoms. Both are fatigue, may dyspnea, cyanotic, kita nyo naman. At yan, orthopnea, pag may mga activity siya, nahirapan huminga, confusion, and restlessness. Sa right-sided heart failure, syempre, the right ventricle of the heart is too weak. And it is, it causes blood to build up naman to. There is a build up in the veins. So nakikita nyo, may parang rope na dito sa leg, vein, jugular vein distension, di ba? Sobrang kitang-kita na ang laki-laki. So retention, ascites, na malaki rin yung tiyan. Tapos malaki. Splenomegaly, saka hepatomegaly. Liver and spleen is also, yan. Weight gain, yan. Di ba? Lumalaki siya. Edema. Mga GI distress. Syempre, there's a build-up in the legs. Syempre, yan. Pwedeng sa paa or sa kamay or even, magkakaroon ng edema din, di ba? Pulmonary edema. Okay? Ayan na lang ang differences. So as for the management, of course, syempre kailangan natin i-decrease yung mga preload, afterload, at increase natin yung contractility. Really important, syempre, continuous vital signs as nurses, magbigay ng oxygen, syempre, nahirapan huminga. As indicated, check ng pulse oximetry, BS, syempre, PO2, diuretics, kasi nga may retention, usually check muna natin yung potassium level kasi syempre may mga potassium sparing tayo, right? Like mga aldactone, aldactone, potassium sparing. Tapos may loop diuretics din nun tayo. Although say loop kasi di ba nakakababa or kailangan i-check talaga yung potassium nakakababa kasi. So we could give aldactone or furosemide naman. Checking the potassium level and other electrolytes. Siyempre, bago magbigay ng mga ganito, kailangan nyo mag-check ng vital signs. Okay? Kasi nakakababa yan ng mga BP sa heart rates. So marami na ako nabigay. Lalo na mga IV push or even drips, kailangan continuous IV or DS monitor. Okay? As for the diet, siyempre sodium intake associated with fluid retention, right? So, kailangan mababa yung sodium. And then, counsel dapat sila mga right diets. Strict INO, syempre, kailangan ng weight monitoring. Usually before breakfast or once, same day, diba? Mas maganda. At least bago siya kumain. Check for anything, mga retention, mga even dyspnea. Abdominal circumference, lalo na pag may patient may ascites, diba? Lahat i-monitor. INO, lahat ng iniinom, baka nga may strict INO, strict fluid restriction, right? May fluid restriction. Fluids. Lagi yan nilalagay, strict INO. Tapos kung ano ibibigay mo, iniinom niya, ay 1 liter lang pala per day. So kailangan i-snack mo. Ay 300 lang po ngayong shift, 300 hanggang sa matapos niya yung limitations niya. At kasi may fluids din, okay? Alright. Kailangan natin ma-check rin yung output kung balance ba as well. And other medications, right? Kung may MI, pwedeng mag-MONA at other blood pressure medications, okay? Meds. And yan, just really basic, patient education, diet, medications, restriction, kailangan mo na magpahinga, bed rest, at kung stable na sila, frequent follow-ups. Okay? So that's it for a short overview with heart failure. Sige, sagutan niyo to. Anong oras na? 11:05. Sige, paki-chat na lang. Left-sided, anong hahanapin? Problems with the lungs. So letter D yan. The rest, right po to, di ba? Retention, edema, jugular veins. Ay, flat pala to. Distended. So, hindi. Hacking cough, hindi naman, but more of, Yan, mga crackles, something like that, wheezes. And then, yan, fix. So the answer here is letter D. D. Okay, good. D, ha? D. So ano pa ang sign, ano pa other symptoms ng symptoms ng left-sided? Please type left L lang problem. Mga niya or top niya, this niya or top niya, yan. Marami, di ba? Sige. Cyanosis, nocturnal dyspnea, restlessness, fatigue, di ba? Pareha sila may fatigue naman actually. Good. Next. Ano to? Right naman tayo. Right-sided. So, alam niyo na. Right-sided. Sige, chat na lang. Mabos na yung oras natin. Edema, di ba? Right. Retention. Edema. Crackles left. Shortness of breath left. Fixed pupils not directly associated, but baka ano na, later on, later stage na yung mga fixed pupils na yun. Not a heart failure. It's a neurologic deficit na. So, yeah. Right, left. Okay? Okay, right. Good. Ano mga ano pa? Other symptoms ng right-sided heart failure? Sige nga, pakitype mga right-sided heart failure. Ano? Ascites, descended jugular vein, hepatomegaly. Oh, galing-galing nyo. Perfect na. Wow, super proud. Diba? GI distress. Edema. Okay, good. Ascites. Ayan, ito ulit. Ulitin lang natin. Sige, isa-isa na lang natin. Pitting edema. Anong pitting edema? Left or right? Right. Right. Okay, right. Liver enlargement. Left or right? Liver enlargement. Retention, right? Retention. Or splenomegaly. Pulmonary edema. Ito, pulmonary edema. Edema rin kasi. Although on the lungs, right? Lung, pulmonary, left. Although pwedeng later on the same, right? Pero pwede nating sabihin ano rin naman yan sa left side. Okay? Yun na lang tandaan nyo. Pulmonary edema. Because of there's a concern. Although edema, pwedeng right. Pero we could be on the side of this niya, of course, lungs, right? Left. Stokes, ayan. It's not really pulmonary related. It is a sign of specific to left side. Although respiration is sinabi ko sa inyo about lungs, right? Baka may stroke, baka may apnea, or pag mamamatay na, di ba? May mga Stokes respirations. So wala yan, okay? Sa iba yan. So ano sagot natin? 2 and 3. So actually mali nga yung nakakalito. So actually B ang sagot dito, pero yung 4 kasi is right. Sige, bonus na lang to. At least alam niya, right? Good. So next. Clear tayo doon. Heart kayo doon. Clear. Ayan, clear kayo dyan. Clear tayo doon. Anong oras na tayo? Time check. Miss Tapasio, oras na. 11:11.
Okay, 11:11.
Sige, malapit na tayo. Sige. Sige, doon tayo pumawi sa mga other questions, sa quizzes. Heart failure na naman. Ano mataas? LDL does not measure heart failure severity. Although, ano daw? Sino yun? Yan, mga LDL, it does not provide further information about heart failure. What is the normal LDL? Siyempre, mga ano, yan, 100. BNP, ano normal BNP? Less than? Normal BNP? Less than? Yan, 100. Yan, sobrang taas, di ba? Baka nasa severe form ng heart failure na to, okay? So letter D is the most concerning here. So letter D, okay? LDL, it does not associate directly to heart failure. BNP tayo ha, yun yung diniscuss natin kanina. Clear, taas kamay. Taas kamay naman tayo. Pagod na yung heart eh, kailangan magpahinga ang puso minsan. Kailangan galaw-galin muna. Okay. Next. Sige. Lapit na tayo. Sige, sa chat box na lang yung iba. Patient with heart failure, may shortness of breath, may crackles, lahat na ng signs ng heart failure. May wheezes, halo-halo. Distended pa yung vein, neck veins. Spirometry. Saan effective ang spirometry? Mga post-op, diba? Mga surgery, kailangan ma-prevent yung pneumonia or atelectasis, kailangan ng IS or incentive spirometry. But it is not helpful, syempre, especially may patient may pulmonary or may edema, right? So kailangan, it's an emergency situation. It's an emergency situation. Okay? It's an emergency situation. Assist, may mga sumagat ng letter B. Supine ba? Supine ba gagawin? Diba? Hirap na nga huminga, isusupine pa natin. Ano ba? Mas better. Diba? Mas okay yung medicine. Fowlers or high fowler or anything that will, kung ano ang comfortable kay patient, right? May hirapan yan huminga at mamamatay lalo yan. Worsen the condition. Client cough and deep breath. Yan, important yan as a nursing assessment or kaso nga, may fluid accumulation, right? Important din naman yan, but yung demand ng fluids at sa may crackles pa, right? Hindi niya pa rin yan. Kaya niya mag-deep breath pero di ba? We need to work on other steps. It's an independent and dependent. Although hindi nakalagay as ordered pero we are assuming it will be part of it. It is the priority. Mag-oxygen na tayo, prepare for diuretic administration, right? So we need to treat the cause. At kailangan ng diuretics, okay? Sa letter D yan. So marami namang sumagot, okay? Nakakalito pero letter D yan, okay? Mas appropriate yung D versus letter C, okay? D versus letter C. Clear tayo doon, taas kamay. Kasi pagod na yung puso. Taas naman tayo ng kamay. Alright. Sige. Next at last. Ay, hindi pa. Meron pa. Okay. Ay, ano to? Okay, sige. Altered level of consciousness. We need to treat the cause. May vein distension, heart rate mataas. Siyempre, anti-inflammatory drugs will be not effective kasi nga, patient with having, distension, retention. Check. Important naman mag-check talaga ng mga pulses, pedal, or, okay? PTT ba or mga BNP muna, right? Important naman yung mga PT rin pa rin actually. But, we're talking about treating the cause. Kailangan mag-diuretics muna tayo, okay? Letter B. You are majority correct. So, babasa kayo sa examination natin. Okay. Letter B. Sige, last concept. Kasi I want to discuss everything about cardiac-related disorders. But, this is our focus later. Next time, siguro mag-discuss pa tayo ng MI. Ng mga cardiac disorders. So, cardiogenic shock, of course, it's a severe form of, heart failure. So, pwedeng may MI, cardiomyopathy, may mga problems, sa vital organs and throughout, everything is in an extreme version. Yun na lang sabihin natin, extreme version. Level 2, level up, heart failure, right? The extreme version of heart failure. Mataas yung preload, yung pump may problema, yung cardiac output, BP drops. Ayan. Even baka heart rate mataas kasi nagko-compensate. There's a compensation, right? Compensation. And really important yan to know that concept as well. So, hindi na natin discuss isa-isa, but yan, that is some of the symptoms or yung mga severe form of heart failure or causes of heart or cardiogenic shock. So, we're talking about cardiogenic shock. Siyempre, it's an extreme level 2 heart failure. There is a decreased perfusion, mababa yung cardiac output, mababa yung BP, nagko-compensate, mataas. Okay? Mataas din yung SVR, nagko-compensate, cool diaphoretic skin, mababa ang urine output, bumababa ang level of consciousness, neurologic, lahat na. May distension kasi nga, di ba, heart failure, crackles, may present na mga abnormal heart sounds. And remember, syempre, there's an initial insult here. There's a broken pump. So anything about broken, nagkakaroon ng mga concerns dito. Right? So ayan. For this concept, syempre, the big thing here is you want to see is, there's an extreme heart failure, right? The blood cannot go forward. So anything about, merong nagko-compensate, so tumataas yung heart rate, yung mga vital organs natin affected, kidney, bumababa, yung neurologic status, lungs, naipapanuminga, diba? Liver, may problem, lahat. And, the bad pump causes, the cardiac output and the blood pressure to drop, so nagko-compensate lahat. And then, it will shunt yung mga, syempre, shunting at nagkakaroon ng mga end stage organ, or the vital organs are affected, neurologic, renal, and GI concerns, di ba? So yan, kapag na severe form, kailangan na ng mga surgical interventions, mga PCI, so percutaneous coronary intervention. So it's an invasive procedure to open the clogs. Cabbage, di ba? Bubuksan yung pinaka-heart na, bypass surgery. So to restore the blood flow of the heart. Para makita yung mga blockages, ayan, kailangan na maraming blood transfusion or standby. Hindi ka makapag-cabbage ng wala mga blood transfusion, mga platelets, lahat ng passing dugo. At yan, IABP, intra-aortic balloon pump. It's it may help the heart pump more blood as well. Mga assistive devices, it's some mechanical implants. to help the weakened heart pump. Or later on, ay kailangan na palang palitan ng heart. Although, mga patient na yan, mga siguro, hospice or palliative na on that concept. At yan, thrombolytics or baka may nga, pero kailangan ng pericardiosynthesis pa rin because of my tamponade. Medications, kailangan magbigay ng dopamine, dobutamine, furosemide to decrease edema, check yung BP. So, really important yan, mga dopa and dobutamine to increase the contractility of the heart. Increase, although mataas na yung heart rate, but it will do vasodilation to decrease the afterload, right? Decreasing afterload. Sige, that's some of the concepts sa bakit heart failure to, cardiogenic shock tayo. Patient education. So there are a lot of nursing priorities that we, really wanted here. Usually, yan sa ICU, critical care yan, or coronary care unit. So here we outline yan, kailangan talaga yung MI lesson, important yan, mga procedure, kung ano yung mga gagawin kay patient, at ano yung mga ibibigay mong gamot. Hindi mo lang basta ibibigay yung gamot, right? Kailangan explain mo yan. Mga positioning, mga medication, what are the side effects. Ano na tong patient natin? There's a shock, right? So probably, baka kailangan talaga we need to emphasize yung perfusion and oxygenation as well. Dealing with anything, right? What is the cause? Kailangan ng supportive treatment. And we as nurses, of course, we need to provide, hindi lang yung ganyan management, but we need to be compassionate with our patient. Kailangan natin, we are here for them no matter what. Okay? So, kailangan ganun pa rin kayo. Hindi lang magbibigay kayo ng gamot-gamot. Kailangan din kayong compassionate with your patients. Okay? Kasi you're the advocate here. Okay. Sige, last questions and then we proceed to the quizzes. 11:30 na. Ay, tapos na pala to. Ito yung kanina actually, di ba? Letter B. Dito na tayo mag-proceed sa quizzes. Kay Ma'am Rona. And then we will conclude later on.
Okay. Sige, start a live quiz tayo.
Oo. Mag-share ka rin
Okay.
para makita
Okay.
nila. Paki-type yung Sino yung ano mo yung link? May pwedeng i-share yung link dyan eh. Kita niyo yung quizzes ni Ma'am Rona. Click mo yung share.
Yes,
Click mo yung share sa chat box.
I-post ko sa ating chat box.
Alright. Sige, bago tayo
Yan,
mag-conclude.
mga pumapasok na.
Quizzes tayo. Share yung screen ko. Pero okay lang. Nasusulat ako. Okay, let's start in 30 seconds. Sige, start na tayo siguro. Alright. We have 30
We
minutes
have
left.
30 minutes left.
We'll start. Can we start, sir?
Start na tayo.
Start na tayo.
Ayan.
Ayan.
Ano daw?
Ano daw?
Bakit ganyan? Bakit ganyan? Left-sided.
Left-sided.
Rackles yan.
Rackles yan.
Ano yan?
Ano yan?
Letter D.
Letter D.
Kanina.
Kanina.
Sige, next na muna tayo.
Next na muna tayo.
I-delete natin yung
I-delete
score
natin
doon.
yung score doon later.
Left-sided
Left-sided.
Rackles. Letter D.
Rackles.
Bakit
Letter
ganyan?
D. Bakit ganyan?
Letter D tayo ha.
Letter D
I-check
tayo ha.
natin letter.
I-check natin letter.
Bakit ganyan na ulit?
Bakit ganyan na ulit?
Sige, next muna tayo.
Next muna tayo.
Tapos na yan.
Tapos na yan.
Bakit ganyan na ulit?
Bakit ganyan na ulit, Miss Rona?
Kasama yung mga heart
Sama
failure.
yung mga heart failure.
Sige.
Sige.
Although right-sided,
Although right-sided,
pitting edema.
pitting edema. Okay.
Sige, letter D.
Okay,
Correct.
letter D, correct.
okay na tayo
Okay,
dyan.
okay na tayo dyan.
Ulit lang.
Ulit lang.
Heart failure.
Heart failure.
Alright, dito tayo
Right, dito tayo magdi-discuss.
Mataas yung
Mataas
heart rate.
yung heart rate.
Wait lang, Miss Tapasio.
Wait lang, Miss Tapasio.
Sige lang, okay na.
Sige lang, okay na.
Asan yung next question?
Asan yung next question?
Ayan.
Ayan.
Mataas yung heart rate.
Mataas yung heart rate.
160 beats per
160
minute.
beats per minute.
What is the following
What is the following
by
access
nurse
by nurse
is appropriate?
is appropriate?
Pag mataas ang heart
Pag
rate,
mataas ang heart rate,
pabababain.
pabababain,
Pabagalin.
pabagalin.
So, paano pabagalin
So,
ang
paano
heart?
pabagalin ang heart?
Oo nga, bakit nag-e-echo?
Oo nga, bakit nag-e-echo?
Wait lang.
Wait lang.
Ayusin ko lang yung ano.
Isin ko lang yung ano ko.
Hello?
Hello?
Eto, nag-e-echo pa ako.
Nag-e-echo pa ako.
Nag-e-echo ako dito.
Nag-e-echo
Hello?
ako dito. Hello?
Hindi naman. Okay na, sir.
Nag-e-echo pa rin?
Nag-e-echo pa rin?
Nag-echo pa.
Sa akin hindi.
O nag-e-echo? Bakit
O nag-e-echo, bakit ganun?
Wala kang audio, sir.
We can
This one, okay
This
na. Mas,
one, okay na.
this one, mas okay?
This one, is okay?
Nakashare ako ng screen.
Nakashare ako ng screen.
Meron
Yes,
meron
sir.
pa rin, sir.
Nakashare count ka daw.
Shares counts ka daw, Miss.
Tanggalin mo na lang siguro yung
Tanggalin mo na lang
sounds.
siguro yung sounds.
Exit mo yung
Exit
share
mo yung
screen.
share screen.
Or yan siguro.
Or yan
X
siguro.
mo yan.
X mo yan.
Kung ano nag-share ka,
Kung ano
medyo
nag-share ka, medyo
echo.
echo.
I-remove ko.
Exit ka.
Exit ka.
Kasi parang walang problema
Kasi parang walang
ko eh.
problema.
Sige, try mong sa'yo. Ayusin. Ayan, di ba pag nagsalita ka wala na?
Wala po, sir.
O, iyan.
Yes,
Sige, mataas ang heart rate, 160, kailangan pabagalin. Hindi naman kailangan, important yung continue monitoring. Pero syempre kailangan, concerning yung heart rate, so kailangan pababagalin natin. Vagal maneuver, pwedeng carotid massage, pwede rin yung mga ice cold towel, pwedeng mag-bearing down, cuffing, para magbumagal, makatulong. Hindi kailangan i-shock. Kasi hindi naman, wala namang, walang code blue rin nangyayari kasi gising naman si patient, right? So, but mataas, SVT, pero hindi naman code blue na kailangan mag-CPR, something like that. Okay? Kailangan pababagalin. So, that's vagal maneuver should be attempted first. Okay? Letter C. Bakit yan? O, sige. Doon kayo sa quizzes, pero mag-share screen na lang ako. Parang ganun. Kasi parang may problema dun sa ni Ma'am Tapasio. Okay, next. Paki-next, Ms. Tapasio. Nag-next na. Sige, dito tayo mag-start. Next.
Ongoing.
Ongoing. Sabihin mo pag ongoing kasi hindi ko nakikita actually. Bakit ganun? Anong tanong niya?
What is the question?
The shock po, sir.
Sa shock. Sige. Medyo nagkakaano tayo technical. Sa shock. Ano yung shock na yun? Okay, sige. Sa shock tayo. Ito, dito sa screen ko. Anong sagot
Yes.
nila? Anong sagot nila dyan?
Letter N, 1, 3, 4.
Okay. Anxiety. Okay. Anxiety, of course, important yan. Pag may shock, it's an indicator of shock. Kanina, di ba? Neurologic concerns. So it's also a manifestation of shock. Relax, syempre normal na yan. Huwag na yan. So mali na agad yung 2. Depressed mood, although it's an, kaso ano na yan di ba? More of depressive states and mas important yung restlessness dito or letter A. 1, 3, and 4. Okay, letter A. Indicator of shock. Probably baka anxious muna siya. Okay? Okay, anxious. Letter A. Sige, next question. Patient, ito ba yung tanong? VTAC, unable to find a
Yes.
pulse. VTAC. Pumasok na yung code team, nagkaroon ng defibrillation, nagbigay ng 360 joules. What is the next step? Ayan, ACLS tayo. Hindi ko naririnig yung sounds mo, pero try mo i-share kung gusto mo. I mean, sa device mo.
51 participants answered letter D,
D.
14 sa
Okay.
letter A, B 37, C 24.
Okay, so we are talking about ACLS at nahirapan mag-pulse at nag-defib. Ano ang next nasa algorithm? Although hindi natin diniscuss pero about cardiac, right? Epinephrine, syempre important yan but the patient is not on asystole, right? Yung mga ganun. Pero ganyan, kasama rin naman yung epi but on that concept, kailangan diretso tayo na mag-CPR na. Okay? So CPR, a patient with pulseless VTAC or ventricular ventilation, it's a shockable rhythm, right? So kailangan ano na tayo, CPR for 2 minutes and then bago mag-check ulit ng EKG and then pulse, the rest will follow. So on that concept sa ACLS, letter D yan, okay? Letter D. Pulse, okay yan, important din naman yan. But chest compression should be immediately given. Manual breaths, naka-bag mask man naman, di ba? Lalo na pag ACLS, dire-diretso naman yun. Okay? May shock, bawal hawakan si patient. So letter D. Next. Sige, next. Ongoing.
Okay, same lead board. So the 84 participants answered letter D. Letter A is 9, B is 29, C is 11.
Alright. Patient with third-degree heart block naman tayo. More of lang tayo. ACLS. May permanent pacemaker earlier in the day. What is the goal of or the priority of nurse choice? So letter A, assist with roam exercises. May kakaano lang, bagong pacemaker, kailangan mag-ano muna yan, pahinga-pahinga muna, okay? Or important din naman yung mga gentle, but it's important to that aspect na kailangan after 24 hours of pacemaker, muna, that concept pwede naman gawin later on, muna, may mas priority. Ensure distal pulses are present. Siyempre, adequate cardiac output is really important here, or the top priority, right? So, kailangan, ayan, sa letter D tayo, maintain the adequate cardiac output. Pain level, siyempre, important din yan to maintain the pain control. Siyempre, airway, breathing, circulation tayo. So, it's really a priority to maintain adequate cardiac output. The rest, naman, di ba? It could be umbrella here, okay? So, letter D, okay? Here, next. Ayan. Heart failure, decreased cardiac output, ang nursing diagnosis natin. Ayan, nakikita ko na nag-quizzes na rin ako. May edema, may, siyempre, decreased urine output. What is the most appropriate for this situation? Tapos na. Trendelenburg, di mas mahirapan at it should be avoided, right? Increase activity by encouraging ambulation. So, pagod na si patient, increase activity pa tayo. Bed rest muna. IV fluid, increase urinary output, edema tayo. Baka strict INO, di ba? So, baka decrease mo ni IV or bakit tayo mag-fluid bolus. So, letter C po tayo dito. Mas important, syempre, although hindi ko na-discuss, but syempre, strain yung heart natin, kailangan mag-stool softener tayo, okay? Because due to the decreased cardiac output, di ba? Para hindi pahinga rin sa heart, less stress on the heart, okay? So, letter C. Sige, next question. Ayan, research tayo. So, okay. So, we're talking about research naman. Nag-research na kayo probably ibang mga levels for entry. Ongoing siguro kayo dyan. So, we're talking about what is the first consideration doing or conducting a research. So, naganap kayo yung title. So, you need to know on that concept. Small experiment methods na to, di ba? Or design. Study statistic, probably pwede. Related hit. Or knowing other studies about cardiac measures, perform observation, di ba? Methods na rin ito. Exploring the knowledge gap. Ano ba yung existing sa topic at bakit yun unique from the others, right? So letter D yan. So it involves data gathering of information, di ba? Bago mag-do na process of research. Okay, so letter D to. Clear? Next. All right. Tapos na, no? So we're talking about action potential, although it's really, you know, actually baka hindi nga na-discuss to, right, sa inyo. But action potential, syempre, it refers to a brief change of voltage. So letter D. So causes yan, of course, it became, or yung positively charged ions, and that concept will be part of the brief change in the voltage. Rapid contraction, no, it refers to the ventricular contraction. Reduction in cell excitability related to, its action potential. It does not describe yung mga reduction cell excitability. And then, ayan, really important yung letter D. Okay, next. Ayan. May mga patient may heart transplant surgery, risk of blood clots because of immobility status. Ba't ganun mo doble? IV potassium, syempre wala namang problema sa potassium. And then it does not relate to blood clots, right? Ambulation. Important syempre mag-ambulate naman. But on that concept rin, di ba? Makakatulong pero hindi siya mas more effective from the mga SCD, mga anti-embolic stockings. Massaging might help, but it's not much more, evidence-based, di ba? So letter A yan, okay? Kailangan mag-anti-embolic stockings. Kasi risk for patient with DPT, okay? Blood clot, it is in, usually sa mga major vein of the pelvis or the lower extremities. Implementation DVT prophylaxis, mga anti-embolic stockings or mga anticoagulants as well. So letter A. Sige, next. Naka-random ata yan, kaya basta nandito sa class point naman yung pinaka-ABC. Alright. CPR, AED. Pumasok na yung AED. Siyempre, pag pumasok yung AED, anong gagawin? Diba? Clear the victim. Okay? Kasi mag-shock ka. Mamaya ka na mag-chest compression kasi mag-AED ka na, right? Important din naman mag-check ng heart rate, pero probably dahil nga on that concept, right? Chest compression are done after the AED, right? So letter D. Clear muna tayo, okay? The rest will follow. Letter D. Next. Ayan, ito yung madali lang to. Na-discuss kanina. Cardiogenic shock usually occurs from Alright, letter D, acute myocardial infarction. The rest, acute blood loss, hypovolemia, hypovolemic shock, spinal cord injury, spinal shock. Alright, so letter D. Next. MI, patient chest to check cardiac rhythm, may sinus tachy, at ventricular fibrillation. What is the heart rate associated with BFib? All right. Rapid and regular heart rate above 300. Sinus tachy, ano yan? 300 is sinus tachycardia naman. So supraventricular tachycardia. Rapid and irregular yan, SVT. Pero ang pinakatanong pala dito is BFib na tayo, okay? Ventricular fibrillation na yung pinaka-final. Okay, so letter yan. There is no rate, edi asystole ito. So wrong. So that is uncoordinated heartbeat with no regular rate. That is ventricular fibrillation, or letter C. Next. Yeah. Evaluating the vessels of the heart. Ayan, of course, evaluation, di ba? Coronary angiography. Coronary heart angio vessels graphy, evaluation or measure. Angioplasty repair yan. Vascular centesis, edi wala namang fluid, right? Removal of fluids. Vasogram, walang ganyan, pero yung vasogram usually dun sa vas deferens daw yan sa mga lalaki. Okay, so letter A, or coronary angiography. Next. Alright. Ang pinaka-important dito is yung kailangan meron silang identification card. Kasi syempre, hindi naman lagi or every, kasi mapapagod naman si patient kung lahat ng meal inactivity. Kung may mga concerns lang doon siya magre-record. Do not wait with patient, do not wait with pacemaker, only showers o babasahin dan. Unless na completely healed, right, with water, iwasan mo na, replace the battery. Matagal po ang pacemaker, more than 12 months yan. Or years po yan bago matanggal yung battery. So kailangan pa rin ng follow-up with the provider. So letter B ang pinaka-importante dito, okay? Carry a pacemaker. Next. Ayan. Patient, we're talking about patient about feeling anxious of the device. What is the most appropriate? So there's no reason to be nervous. Hindi. I understand, but you will not feel the no. It provides a shock. I know I would be nervous, but don't worry, it will be okay, di ba? At least yung letter C mas, may goal, di ba? May, on that concept, we could, give coping mechanism or discuss coping mechanism. As a nurse, kailangan magbigay tayo ng mga other, options at how, on discussing coping mechanism. At mas, di ba, realistic yung letter C. The rest, puro lang, although empathic or therapeutic, but on that side, di ba, dapat both will be the same thing. Being therapeutic, and then you discuss your role as a nurse as well. Okay? So letter C. Next. Sige, malapit na tayo. Ayan. Patient about pacemaker, regulating bradycardia, how to best protect the device. Sleep with arms elevated. Yan, wala namang this is not necessary with the patient with pacemaker. Pwede naman kahit anong position. Apply lotion over the incision site. Di mas, hindi naman yun, di ba? Usually kailangan i-directly put ng lotion unless fully healed, right? Avoid the use of electronic devices. Yan. In general, syempre, pwede naman mag-electronic devices, pero hindi naman yung totally, mga electric appliances. Baka electric appliance. Electronic device, pwede sila mag-cellphone kahit, 6 inches from the pacemaker. Kasi syempre, wala na silang, hindi na sila pwede manood TV, di ba? But however, syempre dapat 5 to 10, pag may silang mga electrical current, naramdaman sila, dapat lumayo sila 5 to 10 feet away. So letter C, mas better they wear loose fit clothings na tinatawag kasi nga, important yan to further care about, discharge infraction, avoid contact sports, magpahinga muna sila, mga electrical appliances, avoid but not just electronic device. Yan. Inform provider pag may mga concerns. So letter C muna tayo. Wear loose fit clothing over the pacemaker. So letter C. Next. CHF, how to be accurate on the measuring INO. Sige, mag-OT tayo ng konti, mga 10 minutes. Alright. How to measure accurate INO. Obtaining verbal count, di ba? Mahirap yan. Minsan makakalimutan na ng patient yan. Usually dapat sinusulat or after uminom or kumain or something like that, i-report na agad. Usually yan, in-instruct namin si patient lang na ako sa med-search. Sulat po kayo or wag niyo po muna itatapon yung ihi niyo. Okay? Sa urinal, maganda yan. Usually, dapat hindi niyo ipapatapon. Kayo na lang magtapon. Okay? So, 3. Charting the amount of IV. Of course, important yan. Informing the client must be recorded. Oo, syempre, kailangan yung i-record yan lagi. Okay? Accounting measure only the food tray. Mali yan. Dapat lahat. So, 2, 3, and 4. Okay? Letter A. Or 2, 3, or 4. Sige, okay? Isip ko na lang to. And we will give the PowerPoint, yung mga sinulat ko dito. T-wave. Ayan. Although some, like calcium, di ba? It is related to the heart. Siyempre, lagi naman yung potassium, di ba? So, tandaan nyo na lang yung T sa T-wave, yung potassium sa T. So, letter C. Next. Sige, malapit na tayo. Ayan. Mga patient, syempre nagsi-CT scan, going to CT scan. Nakita mo, cyanotic na siya. Nahihirapan pa huminga. Di ba? Anong sagot dito? Lumabas sa'yo? Anong lumabas sa sagot mo dyan, Mr. Passion? Calm the patient. Malito ah. Letter D. Bring back to the bed yan. Important to. Kasi nga, na-assess mo na. Huwag ka na mag-check muna or saka ka na. The rest will follow. Ayusin mo muna. Diba? Airway muna. So letter C. Sa susunod, it will follow. Baka kailangan mo ng suction. Next, nag-assess ka naman na. Diba? So letter C. Ayusin namin yung grades dun sa class points. So that's letter C. Ilipat mo siya. Stop the procedure. Ilipat. Siyempre, safety mo muna. Stop mo muna yung procedure. Back to bed. High fowlers. Okay? The rest may follow naman. Oxygen. Baka kailangan oxygen RR. So letter C. Next. Next. Okay, last few questions. Alright. Stress level, syempre, kailangan walang yung stress ng patient, syempre, it will lead to poor muscle tone and decreased activity tolerance. It is not directly associated with on that concept na ay bakit mali yung nabilugan ko. X po yan. It does not lead to poor muscle tone and decreased activity tolerance. Stress causes poor perfusion on distal extremities. Yun. So it does not cause these side effects. And also it does not cause directly to blood clots. So the answer here is it will lead to platelet activation and endothelial function kasi there's there's a negative impact on health. So kailangan there's acute mental stress, syempre kakaroon ng activation of platelets. It affects the arteries, right? So too much stress, it directly related to CAD or increased CAD. So letter C. Next. Sige, tapusin na natin. Priority. For patient prioritization, pneumonia na may antibiotics, pwede na mamaya na yan. Normal naman may pump din yung antibiotics, saka pwede rin, saka na yan. Cause of knee with pain, normal din naman may pain ang cause of patient. Failure to thrive, yan, gutom, At kailangan ng pagkain, syempre pakainin. Normal din yan naman magutom. At hindi na masyadong nakakakain, right? Important yan. Tapos, pupunta pa ng toilet. Diba? Increase bleeding, right? Or baka ma-accidente pa si patient. So, letter A yan. Dapat bed rest lang to actually. So, kailangan letter A muna ang priority here. So, yan. STEMI with heparin infusion. Next. Last 5 questions. Catheterization procedure. Hematoma. Moral courage. Yan. How to increase moral courage? Siyempre, fearing that the others would be disciplined. Oh, madidiscipline naman siya, but it does not relate to the question. Exploring alternatives. Nangyari niya, right? Ano naman normal naman talaga mag-hematoma, lalo na pag hindi na hindi na nagkaroon ng pressure. So, exploring may be not appropriate to encourage moral courage. Deep breaths to control anger. Important din naman mag-deep breathing exercise, but it does not answer the question. Okay? Ayan, maganda may incident at least, di ba? You need to be, accountable also as your actions, right? And then when we talk about this moral courage, syempre, it's a willingness to speak up about situation. At dito sa na to is, the situation warrants reporting. Okay? So letter A. Next. Ayan. Amlodipine is a calcium channel blocker, right? So, syempre, when a calcium channel blocker is given, di ba, less calcium enters the, cell to help with depolarization. So, with that said, syempre, it will decrease the, workload of the heart, right? So, letter A, with less force. Hindi naman papatibukin lahat. Yan. The heart will beat faster. The heart will need more oxygen. The need for oxygen versus increasing the need for oxygen, right? So letter A. Next. Sige, lapit na tayo. Last 4 questions. Patient is taking furosemide, congestive heart failure. What is the priority? Nagtitake ng furo. Lahat yan important. Pero when taking furo, di ba? Electrolytes, saka blood vital signs. Important din naman mag-check ng level of consciousness, abdominal circumference kasi may ascites. But we're talking about furosemide. Bumababa ba yung mga electrolytes? So letter P. So, yan. Lahat yan important sa CHF, right? So, letter B is the most priority here dahil nagtitake ng furosemide. Next. EEE. Diba? Parang imaging yan, parang endoscopy. So, ano ba yung endoscopy? Diba? May pinapasok na scope. Tapos, makikita yung echocardiogram. Kaya makikita yung sound waves ng heart directly, diretso. So, pag nagbibigay yan, diba? Pinapatulog, sinesedate ang patient para ma-relax. Important ang pedal pulse mag-check syempre all throughout. But later on, pwede naman mag-check pa. Okay? Gel, walang gel na nilalagay kasi nga pinapasok sa loob. Lalagyan ng mga sedative or mga anesthesia, right? Anesthetic. Client's leg for straight 6 hours sa ano to, mga coronary angiogram. So letter B, di ba? Dapat ma-check yung gag reflex. Kung bumalik na, kasi important yan para makapag kasi nga naka-NPO siya, right? Para makakaya na rin siya later on. Okay, letter B. Next. Last 2 questions and we'll conclude our activity. Ayan. BNP, syempre sa heart yan. Diniscuss na natin yung kanina. Okay? Next. Okay na. Nawala yung quizzes ko. Ilang percent? Mataas? 205? Ano ang hypertensive drug dito? May angina ba si patient? Naproxen, may pain ba? Novolog insulin yan? Nitroprusside, right? Although hindi natin medyo na-discuss kanina, yan, yung mga other medications such as nitroprusside is a vasodilator to treat hypertension. Okay? Letter C. Okay, last question. Tama ba? Last question na yan, Ms. Alona?
Yes, last question.
Okay na. CHF. Okay na?
Yes.
Okay. Humalog, insulin, morphine for chest pain or opioids na wala namang chest pain si patient or MI. Pwede naman kaso hindi laging naka-standby ang morphine eh. Pwede pa nitroglycerin standby. But we're talking about CHF medication. Thiazide yan. Methyl chlorothiazide is a, what is that? Is a diuretics or for CHF as well. Warfarin, yan. Or heparin anticoagulant, right? So letter C. Tama ba C yung sagot dyan sa grade na grade? Oo,
Yes,
tama.
sir.
Correct. All right. I think that's it for me on my end. I-check na lang natin kung sino yung top 3 dyan kasi may mga kailangan ng DTI representative. So pero sino yung una dyan sa top 1 mo?
So for the top, nag-generate pa lang siya ng out.
Oo.
Yan. So for the top 3,
iba-validate na lang
natin.
kasi meron tayong mga i-correct
Ayan.
natin dun sa
First, for the third placer, Shaira Salud, and the second placer is Dan Precioso,
si Dan
and the
naman.
first placer is Elaine Olivar. I think
Olivar.
Olivar ata yung nawala.
Sige.
Olivar.
Sige, we will validate lang later on kasi may mga corrections para mag-iba yung mga points. Okay? So congratulations for the rest of you. All right. Sige.
Okay.
Yung mga may questions ba pero siguro di-discuss natin. Pwede. Oo, sige. Okay lang yun sa evaluation. Wait lang, ha? Sige. All right. So I'll be closing our presentation today. So nurses are the heart of healthcare. So we're talking about heart, right? Cardiovascular. Siyempre, if you are been cared for a nurse, siyempre, lahat tayo naman magkakasakit. Kayo magiging nurse someday. Siyempre, kailangan papasok dito yung enthusiasm, your passion. And then, whatever is the obstacle here, pero kasi nga ngayong pandemic, really important, our role as nurses. And you, as an aspiring nurse, di ba? Dapat nandyan kayo lagi pa. Patient nyo, ay mga cardiac disorder pa yan or whatever they're having mental concerns, you need to be passionate. You need to embrace your opportunities. If you feel like you're stuck in, something else, right? Dapat, you need to make a conscious effort. Kailangan, may mga learning opportunities niyan someday. And then for you, you never stop learning, no matter how old or what you're going through right now, di ba? And yan, continuous hourly kayo. Clinical rotation, really important yan para ma-apply nyo yung mga concepts into practice, right? We are the foundation of healthcare. Ang vital role natin as is really to provide care. Despite yung pagbibigay ng gamot na sinabi ko, kailangan you provide comfort, compassion for your patients, di ba? Despite of our caring demeanor, di ba? Dapat ang mga priority natin, yung education and something like that. And, kailangan pa rin tayong kailangan talaga. Tayo talaga. Kailangan yung pumasa at mag-move forward, mga level 1, level 2, and 3, 4 kayo dyan. Stay on your, moving forward, di ba? Maintain your perspective. And, yung reward dyan, magiging fruitful yan pag pinaghirapan. But someday, somehow, I will pray for you na lahat kayo maging nurse at hahanapin nyo kayo at magte-thank you kayo kay one nurse at kay Nurse Tapasio at Nurse Royce, right? Providing everything support, coordination to our patient, to our providers. High demand tayo ngayon, right? So kailangan enjoy that moment. Magbasa-basa rin kayo pag may time, right? At, just be your best, all right? Thank you so much for your time. And thank you for your attention at, thank you for spending your Sunday with us. At kami rin, kahit Sunday, nagtuturo kami sa inyo, di ba? Be passionate with what you do, all right?
Really big check yan, sir. Really big check. So, as a part of the program, I would like to present yung ating Certificate of Appreciation to Sir Professor Royce Narvaez, MSNRN, for sharing his explanatory knowledge, experience, and expertise as a guest speaker on the One Nurse NLE Review webinar series with the topic of cardiovascular care management, a nursing perspective. Given this certificate on the 2nd day of October 2022, signed by the founder of onenurse.com, Harojit Sai Kajgumar, ang ating boss pa. Ito tatarang ating boss. No? Yeah, so thank you very much, sir, for sharing with us your knowledge and experience.
See you next week. See you next week.
How you answer those questions. Okay, so as a part of our attendance, last part, you can access all the materials that we actually use here in our webinar with this Google Classroom. So we have both class 1 and class 2. Okay, with the class code of yung one natin, we have B3EYXI2, and class code 2 is 457 VQKS. And again, for the evaluation sheet, please do not forget, no, your voice or your comments is very important to us, no, so that
Correct.
we can improve pa yung ating mga succeeding
At mga
webinars, no?
correct.
Please evaluate
Para
us
tuloy-tuloy,
using
para
the link.
tuloy-tuloy na. Ba't ganun?
I'll be sharing
Ba't
the
ganun?
link siguro.
Nag-e-echo talaga. Nag-e-echo talaga.
So yung mga nanghingi po ng mga slides diyan, dito po sa Google Classroom po natin, pina-flash po natin sa screen. Okay? I-flash ko na rin, i-chat box ko na rin para you can save it, no? Sa ating sa chat. You can copy and then save it so that you can access them. Okay? So without any delay, and I know you're hungry and it's
Correct.
lunchtime already. I would like to end on the behalf of One Nurse NLE webinar series for this session. I would like to thank you. Again, I'm Ronaldin Topacio. I'm the modulator of this session. And thank you very much for bearing with us. Hopefully, you learn a lot, no, in this session. God bless everyone. And thank you for the team also.
Correct.
Bye-bye.
Correct. Paki-share din yung mga next webinar natin sa mga
Okay, I will share the next webinar pala. Just follow guys yung sa Facebook page natin. Yung ating
Yes,
ayun na may ano pa. Ayun na may ano pa.
Ayan si Ma'am. Sige
this
po.
is Maria
This
from
is
One
Maria
Nurse.
from One Nurse.
I'm sorry, it's
I'm sorry, it's
I have a little
I have a
announcement
little
for
annouement
everyone.
for
We are
everyone.
currently
We are
looking
currently
for volunteers for our
volunteers
upcoming
for our
activity
upcoming
here at
activity
One Nurse.
at
So
One Nurse.
with
So
our mission to
our
connect all the
but
to gather all the healthcare professionals, we would like to ask for your support. So we are currently looking for volunteers who can help us realize our mission to
Correct.
gather all to gather all the healthcare professionals in the Philippines. So we will be looking for, it's either students or working professionals from the provinces in the Philippines. So for those who are interested, so it's about 20 volunteers to help us in gathering the healthcare professionals. So to those who are interested, we will be posting a Google form in the Google Classroom. So to those interested, please fill out the form and then we will discuss in details what the activity is all about. And yeah, that's it. And for everyone also, I am inviting everyone, to those who will be interested to go abroad in the future, to attend our webinar tomorrow at 7 p.m. to 8:30 p.m. Our speaker will be the founder of one of the top IELTS review center in the Philippines, Niners. So yes, and they will be giving free one-on-one for those who will attend, but selected participants only. So I'm inviting everyone to please attend, and also invite some of your friends or working professionals who are planning to go to abroad, most especially those countries who are requiring IELTS. So that's all for today. Thank you so much, Sir Royce and Ma'am Ronaldin, for today. Really appreciate it. And thanks everyone also to those who participate.
Okay. Thank
So
you, ma'am. So thank you, everyone. Hope to see you by next week for our next webinar activity. Okay. God bless and happy lunchtime.
Happy lunchtime. Thank you.
Thank you.
We will send